The Pharmaceutical Society of Nigeria PSN Lagos State Branch presents the annual Pharmacy and Scientific Week 2024. Theme: The imperatives of the march towards achieving universal health coverage in Nigeria. Chairman of the occasion, Pharmacist Victor Afolabi, MD Wellness HMO. Keynote address, Pharmacist Kunle Tometi, FPSN, President of Nigeria Association of Pharmacists and Pharmaceutical Scientists in the Americas, NAPSA. Chief host, Professor Cyril Usifo, President, Pharmaceutical Society of Nigeria. Host, Pharmacist Oyekunle Babayemi, Chairman, PSN Lagos State Branch. Masterclass series sponsored by Pfizer Pharmaceuticals, Greenlife Pharmaceuticals Limited, and New Heights Pharma. Starts 9 a.m. prompt on Wednesday, 28 August 2024 at the PSN Lagos Secretariat, Ogudu, Lagos, for both physical and virtual attendees. Grand opening ceremony date Thursday, 29 August 2024. Venue Providence Hotel, Akinjobi Way, Ikeja. Time is 10 a.m. prompt. Red carpet starts by 9 a.m. This hybrid event will be streamed live on PharmaStream TV YouTube channel. Subscribe today for instant notifications when event goes live. Announcer Pharmacist Derek Osondo, Chairman, Planning Committee.
All right. Am I right?
They are checking their calendars.
You're not sure? Check your calendar very well. We promised that we're going to start at exactly 10 o'clock, and if you check your wristwatch, it's 10 o'clock. What is it by your time?
Men of honor.
As men of honor, we join hands to establish the time. It's nice welcoming us to the pre-climax of 2024 Pharmacy Week Lagos State PSN. And the two of us, as always in the last couple of years, will be anchoring this event. I have with me
Pharmacist Oyeniran Adetola.
And I am Charles Akinjobi. My other name in the middle is Akitunde. All right. Thank you very much. We are going to be as formal as possible, but we also want to be as informal as possible. Just to ensure you enjoy yourselves, enjoy the day, have fun. We are not in a pharmacognosy class. Neither is you are in a pharmchem class. You have forgotten your courses? So we are not also in pharmacology class. However, we'll try and as much as possible to ensure that we have the best of the day. So for the privilege of seeing today, can we just give ourselves a round of applause and thank God for a wonderful time. Also for PSN, Lagos State, for the job they are doing. Yesterday was a fantastic time. You've seen, watched the clips, if you were not there. It was a fantastic time we had. 3 master classes. Amazing. Green Life. Let's give it up for Green Life. Let's give them a round of applause. Had so much on malaria. Also, we had New Heights Pharma. Let's give them a round of applause. And of course, Pfizer came with the final bombshell. A round of applause, please. Okay, so today we'll have the grandeur. Today is the opening ceremony of the event. So, like I said yesterday, all the activities from Monday to yesterday were closed events. So today is the opening one. So I'm going to open it up today. So if you have anything recorded on your phone, close it until today before you are free to open. So I want to believe you had photos at the red carpet. You've not taken your pictures? All right, don't worry. Maybe during the break time you can do that quickly. So we have all our guests seated, and I think it's time for us to just keep rolling so that we don't waste any much of our time. Yeah, for the purpose of today's program, permit us to recognize everybody. We are all special. However, I want to just establish the protocols so that we can just kick off from there. We have today
All right, well, welcome to the 2024 Scientific Week. And the theme of this event is the imperative of the march towards achieving universal health coverage in Nigeria. A round of applause for PSN Lagos. We're always blazing the trail. Lagos State is always blazing the trail as far as universal health coverage in Nigeria is concerned.
Yeah, I was talking about trailing the blaze. We just also want to appreciate that yesterday at the master classes, we had over 250 online participants.
A round of applause for pharmacists in the house.
All right, so we have today, this shall be in our midst, we have the chairman of the occasion, Pharmacist Victor Afolabi, MAW, Managing Director, Wellness HMO. And he's here with his wife.
You forgot to mention that he's a graduate of the greatest university, ABU Ahmad Bello Zaria. A round of applause. A ABU graduate is naturally ahead. All the ABU graduates in the house, say hi. Thank you very much. A round of applause for him again. Are we jealous? OAUs and all the Southwest. A round of applause for all the Abu sites in the house. All right, thank you, our chairman.
Yes, wonderful chairman. He's been a wonderful brother. So we also have His Excellency, Mr. Babajide Olushola Sanwo-Olu, the Executive Governor of Lagos State, ably represented today by Dr. Emmanuel Zamba, the Permanent Secretary, Lagos State Health Insurance Agency. Also, the keynote address speaker, pharmacist Dr. Adekunle Tometi, PharmD, FPSN. Also, President-elect NAPSA is in our midst. Pharmacist Professor Cyril Osifo is our chief host. FPSN is the President, Pharmaceutical Society of Nigeria. Permit me, he is yet to be here, but we also acknowledge his office. A round of applause for him. Our host, Pharmacist Babayemi Oyekunle, MAW, Chairman, PSN, Lagos State.
We also like to recognize the presence of pharmacist Biola Adebayo, FPSN, MAW, the DMD Fitsin Healthcare PLC. She's our special guest of honor. A round of applause for him, please. All right, he's on his way. Thank you very much. We also like to recognize all the past chairmen of PSN Lagos State. Please, could they be upstanding for recognition? Past chairmen, PSN Lagos State, they are seated right at the front in their whites. And thank you very much, sir. We also like to recognize in our midst all the fellows of PSN. Please, could you be upstanding? All the fellows of PSN. A round of applause for all our fellows. Thank you very much, sir. We also like to recognize all the fellows of the WPCP, the West African Postgraduate College of Pharmacists. Please, could you be upstanding for recognition? All our consultants in the house. A round of applause for them. Thank you very much. Some people are standing 3-4 times. A round of applause for all the fellows. Thank you.
And I also want to establish the fact that now that you have your allowances coming in, PSN Lagos State will also establish a code for
Consultant pharmacists
to pay extra dues.
All right. We also like to recognize all the Merit Award winners of PSN in the house, both brand new and the ancient ones. Could you be upstanding MAWs, PSN Lagos? Thank you very much. A round of applause for all our Merit Award winners. Thank you very much. We also like to recognize in our midst all the directors of pharmacy, HMB Board, Ministry of Health Lagos, Pharmacy Council of Nigeria, all the directors of pharmacy in the house. Please, could you be upstanding for recognition? Thank you very much. I can see somebody that has stood up 6 times.
All right. We also want to recognize, before we move, the chairman or chairwomen of all the technical arms and interest groups of PSN Lagos State Chapter. 7th time.
7th time. A round of applause.
Okay, chairman, national chairman of all technical arms of PSN, NEIP, NAHAB, now everybody. Are they present? All right, we've established that protocol. Captains of industry.
All
MDs.
the captains of industries present, please could you be upstanding for recognition? A round of applause for them. Thank you very much. Some of them are still on their way.
We also want to permit us to please also establish the presence of the senior special advisor to the governor on health. Sorry for this coming late. She was in as early as 30 thereabout. We are sorry, ma. Dr. Oluwatomi Adeyemi. She came very early. Thank you very much, ma. Sorry for skipping that.
Thank you for honoring our invitation. A round of applause for her again. Thank you, ma.
And all distinguished colleagues, pharmacists present in the house, please, can you give yourself a round of applause? Gentlemen of the 4th realm of the estate, journalists, all distinguished journalists in our midst, please, can you be upstanding for recognition? If you're a journalist, okay, we have one. Any other journalists in the house?
They are on their way.
All right, okay. Now, having established this protocol, please, we want to go straight. Okay, let's also quickly take this. I saw him and he has not really transmitted so much. Let's really appreciate pharmacist Professor Adeleke Adebajo, the Dean of the Faculty of Pharmacy, LASU.
We forgot to add brand new faculty.
Brand faculty. And I got this information that the faculty is also transmuting, the college is transmuting to University of Medicine and Health Sciences. So that's a good one. We are supposed to have a company presentation. I don't know if they are ready. Are they ready? Okay. If not, ladies and gentlemen, the media, are we ready for the national anthem? Let's take the national anthem.
Please, could we be upstanding for the national anthem?
Nigeria, we hail thee, our own dear native land, who tribes of medieval, in brotherhood we stand. Nigerians own and proud to serve our sovereign motherland. that fruit and justice reign. In peace all battle honored, and this we count as gain. To hand unto our children a banner without stain. O God of all creation, grant this our one request. Help us to build our nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed.
Amen.
Amen.
Nigeria is blessed. So we move on quickly, and we have the company set. Oh, great. Thank you, sir. Okay, we have coming forward is Chidima Chigo.
General Manager, Business Developer of the Clearline HMO. A round of applause for her. Chidima Chidigo, she's the General Manager and also the Business Developer for Clearline HMO. A round of applause for her. She comes forward. Thank you very much.
The better you clap, the faster she comes.
Good morning, everyone. It's such a pleasure to be standing before very prominent men and women. Congratulations on a most successful scientific week for the Pharmaceutical Society of Nigeria, Lagos branch. Thank you. Thank you so much for having us here. I would like encouraging faces. Smile. Someone looking at me is already smiling. Please, the country is so hard. When you see your brother in this time, it's best to just smile and encourage them. Thank you so very much. All right. I particularly like the theme for this year's scientific week, which says the imperatives of the march towards achieving universal health coverage in Nigeria. It's a long way, but we are getting closer. I'd like to especially acknowledge the MD of Wellness HMO who is here. The egg was in the house. Thank you very much. I'd like to also recognize the presence of Zamba from Lashma, the permanent secretary. I'd like to acknowledge especially. Thank you so much. How many of you here know what the Health Maintenance Organization is or what it's about? But I like to always just say that the HMO is your peace of mind, is your lifesaver. All right. What we do cannot be equaled and can't be explained, put in words. Only the testimonials from those who have used a HMO service before now have seen it will tell the story of how it is and why it is crucial as a financial tool to have one. All right. When you're planning your finances, it's incomplete if you haven't planned for your health in that year. And the best way to plan for health is by health plan, by a HMO. It's a lifesaver. And in my HMO, we've been over 30 years. In fact, we just marked our 30th year, January 17th of this year. So we've been around, we've gone through the entire phase, and we are still standing very strong. I won't take a lot of your time. We are at the back exhibiting And we would like to call on you to stop by our stand. My colleagues and I would, put you through on what plans and benefits, all right, you will draw from when you join or when you sign up to be an enrollee of my HMO. I can only guarantee you very few things. We have one of the widest network coverages with over 2,000 hospitals spread across Nigeria. I mean, that's a lot, offering you the services that you deserve, cut across all strata and all the specialty that you would actually want to access. See the wellness, which we are big on right now. So you have the gyms and spa. Is it the specialist services? Is it the primary, the secondary, the tertiary care? We have facilities, even in the most remotest part of the country. All right. So you can trust that Clearline is anywhere you go. And we can guarantee that in recent times, we found that the cost of wellness and driving preventive care is better, both for the individual or even the organization. So we are big on wellness in recent times, where we are advocating lifestyle choices, where we are advocating that people change lifestyles, so we are having health talk, wellness activities with clients. We are having, we've organized several outreaches, in recent time, very recently, the World Malaria Day, where we were different communities to take the Eradicate Malaria campaign to them. So for us, we are very big on wellness. So when you're signing on to my HMO, you'll be sure that you're getting health tips. You're getting newsletters on trending health matters. We want to keep you fit. We know you are at your best optimal when you're healthy. All right. So when you sign on to my HMO, that is part of what you are getting. And most importantly, I can guarantee you peace of mind when you sign on with Clearline HMO. You can go to the hospital and access that care that you desire without having to bear the cost of huge health care burdens, even in this time, when the cost of health care is spiraling out of control. You have that covered, and we got you covered. So I would really be pleased to welcome you at our stand, when it's time, and you can be sure that we'll walk you through the plans we have for you, and very specially for even the PSN family. Some of you are already on our network, and we want to appreciate you using this medium, and we are ready to welcome even more people, into our network. Thank you so very much, and enjoy the rest of this event.
Thank you very much, Clearline. Let's quickly welcome the chairman of the planning committee, Pharmacist Derek Osondu, MAW, to give us his address. He has been working tirelessly. I think this man deserves a round of applause. And he's a member of his team.
Good morning, distinguished ladies and gentlemen. I will stand on the protocol established by the Masters of Ceremony. I think if you open to page 17, the address is there on the brochure. So on behalf of the PSN Lagos State and the entire members of the Planning Committee, I welcome you to this August Assembly, which happens to be the grand opening ceremony of the 2024 Scientific Week of the Pharmacy Society of Nigeria, Lagos State Chapter, aptly themed the imperative of the march towards achieving universal health coverage in Nigeria. I strongly believe this opening ceremony will create a platform for pharmacists to deepen the conversation around achieving universal health coverage under the distinguished guidance of today's occasion chairman, Pharm Victor Afolabi, and the keynote speaker, Dr. Dekunle Tometi. The occasion will also serve as an avenue for pharmacists from all walks of life to come together in fellowship, network, and bond in a convivial and congenial atmosphere that is indeed pleasing to the senses. Let me at this juncture profoundly thank the sponsors, exhibitors, and those who supported with goodwill messages, products. Your effort contributed in no small measure to the success of this entire scientific week. Special recognition goes to all members of the planning committee for putting in their best to ensure that we successfully pulled this off. To the chairman, PSN Lagos, Pharm Babayemi Oyekule, and all members of the state executive, I appreciate the privilege given to me to serve as the chairman of the 2024 Scientific Week Planning Committee. Thank you for the honor. So once again, let me welcome you to this event. Sit back, relax, and do enjoy all PSN Lagos has lined up for you today. Thank you, and God bless.
Please, a round of applause again for the Chairman Planning Committee of the 2024 Lagos PSN Scientific Conference. Thank you very much, Pharmacist Derek Osondu. All right, we'll be going straight to the... Okay.
Thank you very much, our chairman. We will go straight to goodwill messages. We just keep the right one. And I also want to welcome at this juncture the director, the zonal director for PCN Lagos.
You will have allowed me to do the welcoming. You want me to receive query letter. We would like to welcome into our midst Dr. T.E. Felusi, the zonal director in charge of the Lagos PCN zonal office. Welcome, sir. A round of applause for him. Please up. Okay. Please come up for your goodwill message, sir.
A round of applause more for him. He's ever ready. Please, if you have not collected your license, you can just collect after the speech.
Express.
Good morning, the chairman, PSN Lagos, and members of the high table. I plead to align with the existing protocol. I want to congratulate the PSN Lagos for another year and another week of this scientific week that we are having. The theme of this time, the imperatives or the march towards achieving universal health coverage in Nigeria, is very key and is very apt. And thank God we've been having it in various fora. I just want to encourage you, as we know that pharmacies are the backbone of the healthcare system, providing essential medicines and pharmaceutical services to millions of Nigeria. And we cannot afford to let down our guard and the honor and the responsibility that the nation has bestowed upon us. We know that we have the honors, the responsibility to ensure that every Nigerian has access to quality healthcare, especially affordable and quality medications in every nook and cranny of Lagos and in the entire country. We want to, from the Pharmacists Council, know that we want to encourage everyone to ensure that we key in to part of the programs we are driving at the Pharmacy Council of Nigeria. Let me just talk about one or two of them. We know that the open drug market is a veritable source of fake and of substandard medicines, and we have encouraged manufacturers and our importers that are here to not to feed the open drug market. And we thank God some have given good response that they will stop. We want everyone to continue in that. And we are driving the coordinated OC centers to ensure that drugs are marketed in a regulated environment. The coordinated OC centers are different stages of development across the country. The Lagos in particular had some issues to have gone so far, but the PCN is making every move and deploying strategies to ensure that all those issues are taken out of the way. We're expecting the Lagos coordinated OSA centers to continue as soon as possible. And then also, we are also driving, we want pharmaceutical premises across every nook and cranny of Nigeria. And that's why we're also driving the satellite pharmacy project. Very soon, we're going to be having the regulations coming across our platforms on how to ensure that we can and ensure that in all the nooks and crannies, especially the outskirts of Lagos, pharmacists can own premises all over. Then also, when the regulations is out, just look out and then try to key in. This is August, towards August ending. I expect all the pharmacists here to have registered themselves and their premises. I hope I'm right. If you have not, the statistics we had, last week we were in a meeting in the head office, the statistics we had of those that have registered was alarming. Very few, not really encouraging. So if you are not done that, please get it done. And if you have any issue, we have our open lines, both in Lagos here and in Abuja. We are ready to help you. Before I drop, recently in Lagos, we had some little SOP or principles that we want people to come and pick their scratch card when they are registering. We have some feedbacks that it's inconveniencing. Yes, we try to know some people that may not be able to make it because of their busy schedule or one thing or the other, but we try as much as possible to ensure that you come. One of the things we are guiding against is that some people, actually what led to that was that somebody was abroad and has been abroad for more than 8 years, and another person was using his license to register a premises in Nigeria for continuously. And that's one that we're trying to guide against, that if you just come to the pharmacy council once, visit us and pick your scratch card, and then come, let your license, except when you can't make it. This one led to a fact when we said that, when some people brought a feedback that they may not be able to do, we said you should try, except you can't make it, then we'll waive it for you. We now said that if somebody that is abroad for 8 years can be registered, the license can be used, that a dead pharmacist license can also be used. I said, no, it's not possible. There's no way it will work out, until about a month ago, when we actually discover someone that has died 3 years ago, a license was displayed at the superintendent pharmacist of a premises somewhere. So we are trying to guide against that. So try to cooperate with Pharmacy Council as we drive different strategies to ensure that we have an issue regulation of a pharmacy profession. We want to wish you fruitful deliberations as we continue in the conference. Thank you, and God bless you.
Thank you very much, sir. We really appreciate each time he comes to our event, he's always coming with very detailed information and usable ones. So once again, can we just give him another round of applause? Quickly, we also would, at this juncture, inform us that we have in our midst the National Secretary of PSN, Pharmacist Gafar Madein, FPSN.
A round of applause for him.
And also representing the president in council. You're welcome, sir. In our midst also is our father, Pharmacist Deji Oshinaike, FPSN Chairman, Board of Trustees, PSN Lagos. I also want to, for the second time, I will do that and continue to do that, Dr. Oluwatoni Adeyemi, the Senior Special Assistant to the Governor on Health. She's been with us and she's still with us. So we recognize you, ma'am.
Thank you very much, ma'am.
I'll be calling up to the podium to give his goodwill message, Professor Adebajo, the Dean, Faculty of Pharmacy, LASU.
Good morning, House. All protocol duly observed. I think I recognize the chairman of the Lagos State PSN. I could see old colleagues. I graduated in OAU 1983. And I saw Remigius, I saw Bola. We used to call her Bola Shokada. I think she's now Bola, the former dean, Faculty of Pharmacy, Unilag. Well, by the grace of God, I attended the meeting that we had at the Secretariat, and there I gave a little address. So I was told 2 minutes, so I'm not going to repeat myself, other than to thank you all, which I also mentioned that day. I came in only, but I've heard the stories about the great work that the PSN Lagos State did in ensuring that the Faculty of Pharmacy come to being. It was long overdue. Thank you so much. Thank you so much. It was long overdue. Actually, last year, the college became 25 years, and the Faculty of Pharmacy became 0-year-old. So we came in at the age of 25. By the grace of God, we have been trying to do what we know best to do. We have gotten, well, the resource verification came from NUC, and they gave us the go-ahead. And also the advisory visit of the PCN came, also we skate through. And by the grace of God, the college is actually turning into a university and made up of faculties. And Faculty of Pharmacy is one of them. Also, I learned from the provost that the Department of Nursing will also change to a faculty. So I think with all these things, they can only be better. I'll be calling on individuals. I'll be calling on us as a group through the chairman when we need your assistance. Will we? Definitely need your assistance. That one is great. I'm a Yoruba man. They say, "Enteba balaba in Baba." Okay? And I also want to say that I can actually see Mama. So we have Baba and Mama here waiting for us. And I want to thank you for the welcome that we have been given through the chairman, and also everybody that have said, "Oh, you are welcome, welcome." Yes, I left Lagos at the age of 18. I came back to Lagos at the age of 64. In between those years, I was maturing. And I thank God, I give God all the glory. So I'm happy to be here. I was here last year, with Siri Sufu. I'm also here, and I can promise, except I'm busy, the professional harm, which I've neglected a bit, I'm picking it up. I was strong NAPA member, but now coming back to serve the profession fully. God bless you. Thank you so much.
Thank you so much, Prof. We really appreciate your presence. We also believe by God's grace you'll be here next year. Yes, we have also in our midst the chairman, Medical Lab Scientists Association of Nigeria, Mr. Abioye Omoyemi Akinjobi.
A round of applause for him as he comes to give his goodwill message.
Give us a goodwill message.
Mr. Abioye Omoyemi Akinjobi. A round of applause again. Thank you very much for honoring our invitation.
Good morning, distinguished pharmacists. I want to stand on the existing protocols that was initially established. But however, I want to recognize the Special Assistant to the Governor on Health. Good morning. Well, I bring you good tidings from the Association of Medical Lab Scientists of Nigeria, Lagos State Branch. And I want to say that I'm happy to be in your midst. And I want to also say that the theme of this year's conference, the 24th Scientific Week, is very germane and is apt. The imperative of the march towards achieving universal health coverage in Nigeria is very apt, and it's a very sensitive topic. In recent times, we all know that we as Nigerians, there's need for equity in health, and there's need for this universal coverage. In recent times, we also understand that what's usually play out here in Lagos and in Nigeria at large is out-of-pocket payments for health. And that has actually reduced or actually stand between accessibility to health. And we all know that when individuals come down with different medical health conditions, some find it difficult to access health. So with this theme, I think it's very, very key. And I know that we're going to listen to our erudite scholars to tell us, to give us the wherewithal, to give us how we can do it to have this equity in health and to have this accessibility in health. Once again, I want to congratulate the chairman, pharmacist Oyekunle, for these milestone achievements. I want to congratulate you for putting this together. I want to say that in no time, there's need for better collaboration between the professional associations so that we can reach our desired goal. So on that note, I congratulate all the pharmacists in the house for their 24th week anniversary. Thank you and God bless you.
Thank you very much, sir. A round of applause once again for him. We'll be listening to the opening remarks by the chairman of this occasion. I would like us to give him a round of applause. Pharmacist Benga Afolabi, MAW, MD Wellness HMO. As he comes forward, I also like us to give a round of applause to his amiable wife seated by his side, Pharmacist Adetutu Afolabi. She's behind every successful man, there's another successful woman. A round of applause for them. Thank you very much, sir.
While we're making effort to welcome the chairman of today's occasion, we have the honor of having in our midst the Permanent Secretary, Lagos State Health Insurance Agency. All right. Our own Dr. Emanuela Zamba, representing His Excellency Mr. Babajide Olusola Sanwo-Olu, the Executive Governor of Lagos State. One more time, please, a round of applause for her. You are most welcome.
Thank you very much. Well, I would like to stand on all the existing protocols so that I do not take too much of our time. But it's also proper that I recognize key people in the house, the representative of Mr. Governor, the PS of Lashma, you're welcome, ma'am. The SSC on Health, you're welcome, ma'am. Nice to have you. And again, this is my constituency. And so I want to recognize all the senior colleagues that we have in the house. I did internship in PCN in 2001 or thereabout. And so Dr. Famlis was my HOD. HOD. Phyllis, yes, he was my HOD then. And I'm just looking for where he's seated. But So again, it brings back memories. And I've had quite a number of senior colleagues in-house today. And so being the chairman of this scientific conference, I think is quite humbling. And I want to say thank you to the chairman of PSN, Lagos State, great and amiable man. Thank you for all the work you're doing. Thank you for the chairman organizing committee for inviting me to come speak today. And in about 5-7 minutes thereabout, I'll just give context to what I'm saying. And of course, I have to, so that I can. Funnily enough, she drove me this morning because I've been struggling with gout for a while, so I've been struggling to drive. So my wife, my business partner, my friend of 22 years, okay? My wife of, we've been friends for 22 years. She's married me for 19 years. We've worked together for 17 years. She actually she forced me off the management of Wellness HMO. So when people call me CEO, I keep saying that NHIA can take me, hold me responsible for that. She's the MD of Wellness HMO. I rotated out. I rotated out to join the board, and because I had other commitments, and so she does the day-to-day running. But again, it's my journey in the health insurance space has been over a decade. And I do remember then that when the whole restructuring and recapitalization of health insurance happened in 2013, 2014, that was when we believed as pharmacists that the whole concept of health economics transcends just patient care in terms of prescription of drugs and struggling about who owns the patient. It's more about how do we drive affordability and universal coverage. And that for us was the driving mission that took us in there. And the journey has been quite interesting the last over a decade there, about 10 to 12 years. But it's exciting to see how things have evolved. And as pharmacists today, what I will, of course, as we sit through the scientific conference, and I expect the keynote speaker to do a lot of justice to this, I'd just like to encourage us and give a charge that as pharmacists, we should be at the forefront of the health economics charge. And why am I using the word health economics? It's because the conversation about health, for it to be affordable to people and accessible to people, we need to wear a new thinking cap where we're looking at what is the whole conversation about health economics. And that's why, for me, I think this is my fourth pharmacy function where I was speaking, is as keynote speaker, as chairman, talking about the need for pharmacists to step up. My journey in the last 22, 23 years has taken me across different sectors. And in one of the sectors, because I've changed career 4 times, people ask me what I'm looking for, but it's fine. In one of the sectors where I worked, I learned about the consumer because I did a master's in consumer psychology, and it's shaped most of what I've done over the years. And one of the interesting things about the consumers, which medical people call your patient, is the fact that it's very difficult to change consumer habits, if almost impossible. You don't bribe a consumer. What we understand from consumer psychology and the world of marketing, brand management, and strategy is the fact that you need to understand the consumer and walk around the consumer journey to be able to engage them. And what is this about? It's the fact that what I've seen over the 10 years is us trying to create another route, another method, another way for consumers or our patients to access care, rather than for us to see what is their natural default and see how we enrich them on that part. And that's why I think pharmacists should be at the forefront of this. The average Nigerian today, we're not as sophisticated in terms of our shopping habits as so many other clients. If the pharmacy outlet is the main point of call, or the first place where they get to access care, to complain, proximity, I think, and it's been my advocacy over the years, even while I was quite active in there, that we must, from a policy point of view and advocacy as a body, get pharmacies and pharmacies to be recognized as primary healthcare provider, first point of call, and make sure that we act as such. I mean, congratulations. I know in Lagos State, health service. We now have the consultancy grade and all that. And I think all of that speaks to what the role should be and how there should be a change. Because again, this is how people are. And I'll borrow a leaf, okay? I used to work in a multinational as a marketing strategist and a brand person when in 2009, no, earlier than that, 8 or 9, we saw the advent of big malls coming to this place, the ShopRites and all that. And I remember that I was part of the strategy team, traveled around, and we kept saying, is this a fad or is this our consumer habits? Will our people continue to shop at the close proximity neighborhood stores, or will they take the European lifestyle and move to the malls? Again, our feedback then was, we think why people go to the neighborhood store, they get credit, they recognize them, they call them because of our nature. The chances that people will continue to patronize people close to them where they can get credits, they can, you call them by name, you know what they need. That association will ensure that the natural defaults of the people remain the proximity stores. Years have proven that we were right. I used to work in Nestle then. We see that a lot of people have gone to the big malls, difficult to maintain and expensive, to take pictures. But where do they really buy their products? The person next to them. Where they can drop some money, and when they run out of money, my salary will come. Give me Lipton. My kids are going to school. That's who we are. No matter how big you make those malls, there will be places of entertainment and whatever you are. Same thing with the patient care. As policymakers and who are seated in here, as people who advocate, we need to understand the Nigerian consumer. Where do they want to be? And when we're talking about affordability, while we clearly understand the primary health cares are important, they might not necessarily provide the proximity and that first point of call when we're talking about universal coverage. Why? If I'm a medical doctor and I've worked in a hospital, worked in a psychiatric hospital, I've got the cost. I remember I had a session like this and I spoke as keynote for NIPE, industry. And I said, look, what's the 5 ways? And I'll round up quickly, okay? I just get excited. What's the 5 ways you make money from a patient in a hospital? Your clerk, you come in, and HMOs, clear line, wellness, and you pay for, consultation fee. That's one revenue source. Second revenue source, can someone help me? So that I know I'm not talking to myself. Second revenue source. I can't hear that. Clerking, then lab test, the third one. That's investigation. Admission. That means you keep them in. The next one, procedure. The last one, drugs. 5 revenue sources. You map it out. Guess what? The hospital, either government or primary health care center, to keep that OPEX, need to share costs across those places. Where do you think is the easiest to put so much cost to absorb the OPEX? It's around the medicines. And it's the reality. But it's not people being bad. It's because I've got to pay the nurses. I've got to pay the cleaners. I've got to pay the people in the lab. By the time you look at all the OPEX of running either a primary health care center or running a typical hospital, secondary care center, the cost, when it's translated to each patient that walks in, they cannot bear the cost. We must relook our model. And that's why I'm excited about the topic of today. That we all need to understand that the average Nigerian cannot continue to carry the cost. I will not call it inefficiencies. The high OPEX cost of running the healthcare structure. The patient can't afford it anymore. If the patient now says, I have 2,000 naira and I go to the next proximity pharmacy outlet, which should be designated the place of first call, and I go in there with 2,000 naira, the person is able to offer free consultation, no clerking, get you to climb the scale and all that, and based on experience, is able to use 2,000 naira to manage that case and you go home. Trust me, your shoppers, your consumers, your patients will continue till eternity to use that place of point of call, except the standard of living and our GDP and begins to go up and they begin to get more affluent. Reality. So what's my charge to us as I round up? And I'm happy policymakers are here. And I did say this, I think that was in 2016. No, Professor Adewale, we gathered all the MDs of HMOs, 9th floor Ministry of Health, Abuja. And they said they wanted to renovate 10,000 primary healthcare centers. And all the HMOs MD was there. And I was young and I raised my hand. And I said, I don't see that as a good way to spend money. Of course, it was not popular. Why are you renovating things, shells, where what makes a primary healthcare center is the people there and the medicine there? Are there other ways to reach those people? Are there other ways they can access care without having huge OPEX? So we wanted to discuss billions to fix roof, which medical doctor will go and sit in my village where there's no roundabout? We have only one road passing all through. It's not on the map. They won't read medicine and go in there. So question is, we need to rethink the model. So to round up, we must embrace the role of educators and advocates for our patients. That's what I think we should as pharmacists. Helping them navigate the complexity of health insurance and managed care system. We need to make sure that every of these pharmacies are integrated into the primary health care structure. So that when Lagos State is calculating their PHCs, we can have all these other coming there. Because in achieving universal health coverage in Nigeria, it's not a distant dream but a possible reality. It requires us as pharmacists to fully embrace our role in managed care. We must not just be participants. We can't be traders. I struggle when I hear the word shop. That's why I didn't last. She chased me out of those shops those days. She was always complaining that I would not sit to attend to patients. I'm too restless. Thank God I didn't read that medicine that my mom told me to do. I would have killed all the patients. I'm too restless to sit in one place. But pharmacists must go beyond just prescribing and all that. We need to play active roles. You need to understand the patient. You need to upgrade. If you see yourself as the first point of call of patient care, it will not just be about how much did we sell today, how much is the cash. And your thinking needs to be elevated beyond that so that we can be integrated into it. Integrated not because of our own interest. Finally about the patient and it's best for government. That's the way the policy will work. You will not achieve universal health coverage if we continue to look at how many healthcare centers we can build. We must join to participants, but in leaders in our field, advocates for our patients and collaborators with other health professionals. Let us work together to make a healthy equity a reality for every Nigerian, ensuring that every interaction contributes to a healthier, more equitable Nigeria. I want to thank all of you for your unwavering commitment to this cause. And I want to encourage that as deliberations go on, as the keynote comes in, as the representative of Mr. Governor comes in and the drivers of LASHMA, I do hope that this conference will come out with recommendations that will make all of us not worry about our interest, our profession, our profits and all that. But remember that it's when the nation is healthy, that's when we have a productive nation. We're seeing a lot of young people drop dead, and it's becoming an epidemic we're seeing in the news right now. Okay? 30-year-olds, 40-year-olds. It means that the more we do not see this universal health coverage as an emergency that we need to quickly deliver and solve, the more we waste time on that, the more we have an unproductive nation of young people. And finally, when the nation is not productive, the marginal contribution begins to drop because consumption comes from a healthy population. And I do hope, as policymakers, as practitioners, as advocates, and as well-wishers generally, we will leave this scientific conference having thought of a new way to expand our health insurance model and ensure that everybody and anybody enjoys good health care in this country. Thank you very much. And I wish all of us a successful conference.
If there is anything that was a takeaway, let's rethink the model. Thank you, Mr. Chairman. We have in our midst one of the model rethinkers, and model remodelers. We have pharmacist Olumide Akintayo FPSN, a model on his own, a remodeler on his own, and also a thinker and rethinker. You're welcome, sir. Thank you. Now, we are beginning to reshape and shaping the model as we welcome the chairman of PSN Lagos State Branch, Pharmacist Babayemi Oyekunle, MAW, to give his address.
Good afternoon, everybody. Let me try to establish protocol. The Executive Governor of Lagos State, the State of Excellence, Mr. Babatunde Sanwo-Olu, Babajide Olushola Sanwo-Olu, who is actually the 15th governor of this state, Dr. Emanuela Zamba, the PAMSEC Lashma, is representing him here today. So you are welcome, man. I indeed deliberately made sure that my speech will be when the representative of the governor will be sitting down. Because if you look at your program, you will see that we have actually altered a lot of things. And let me say this to Dr. Emmanuel Samba, that we actually appreciate your presence, because we have had several phone calls today, because to be very frank with you, ma, we've tried several times to get the governor, and anytime we are not sure that he's not going to be around, some of the things that we have actually planned or some of the items on our programs, we'll have to change it. Even up till about 2, 3, 4 days, I was trying to contact the office of the governor to be sure that Mr. Governor will be around. But I thank God, and I thank some of the people that have actually done so many things to make sure that at least we have the representative of the governor present here today. So you are welcome, man. Why I'm actually welcoming Dr. Samba is that some of the things that we will have to engage ourselves with in my speech here is also going to be directed to our office. And I want her to take it in their strides and make sure that the governor gets to hear it and the appropriate things are done. Especially, riding on what the chairman of the occasion have actually said. The patient is all our patient. It's not anybody's patient. So you are welcome, man. Thank you very much. So let me also welcome my brother pharmacist Victor Olugbenga Folabi, a merit award winner of our state, though a pharmacist, but he's also a business curator, consummate venture analyst and builder. He's also the chairman of Wellness Healthcare Group. You are welcome, sir. Yes, one of my over 30 years friend and colleague, the keynote address speaker, pharmacist Dr. Adekunle Tometi, is the president-elect Nigerian Association of Pharmacists and Pharmaceutical Scientists in the Americas, NAPSA. Let us appreciate him. He will be taking over as the president by this September. Am I right? Next year. Okay. So you are welcome, sir. NAPSA is the umbrella for those that doesn't know about NAPSA. NAPSA is the umbrella organization of Nigerian pharmacists, pharmaceutical scientists, allied scientists, and the academia in the Americas. So you are welcome, sir. Let me also appreciate the SSA, even to the governor. She has been here for quite some time. So you are welcome, ma. Thank you very much for attending our program. Let me appreciate the remodeler as the the MC has actually labeled him. He has so many names. You know, behind his back, I call him the jurisprudence. Because when you talk about forensic pharmacy and pharmacy law, you know, Professor Olumide Akintayo is actually a professor of pharmacy law. And he's a past president of the Pharmaceutical Society of Nigeria and also a past chairman of the Pharmaceutical Society of Nigeria Lagos State Branch. So I welcome you warmly to this occasion, sir. Let me also, welcome our daddy, the BOT chairman, Sir Deji Oshinoiki, FPSN. You are welcome, sir. So as to save time, let me greet all my past chairmen, the living ancestors of Lagos State. There are about almost 7 or 8 of them sitting on this part of the table. Please, I crave your indulgence to just rise up and let all of you be appreciated together. The past chairman of Lagos State, PSN. We are trying to establish protocols. So all the fellows in the house, also I greet you. Please, all the fellows in the house, fellow of the Pharmaceutical Society of Nigeria, please stand up for your due recognition. Fellows of the Pharmaceutical Society. That is the highest award in the Pharmaceutical Society of Nigeria. So it's not an easy thing to become a fellow. So you are all welcome, sirs and ma'ams. Then there's also the Merit Award winners. That's the highest award in Lagos State. These are people that have, served and are continue to serve the society and even the pharmacy profession. So all Merit Award winners, I crave your indulgence to stand up and be recognized. Merit Award winners of Lagos State. So you are all welcome. All the chairmen of the technical arms and interest group, I appreciate you. Distinguished colleagues, friends of pharmacy, the chairman of the Association of Medical Lab Scientists, and other healthcare professionals, chairmen that are around, ladies and gentlemen, you are all welcome to this address, to the opening ceremony of this year 2024 Pharmacy Scientific Week. I find it very imperative to give all glory to the Almighty God for sparing our lives to witness another welcome address at this year, that is this 2024 opening ceremony of the annual Scientific Week. Let me declare that this leadership strides assures, and I want to that it transverse most of our state branches of the technical and interest group, as well as confronting most of our challenges headlong. With some of the measure of, we have some measures of success stories here and there. But for a proper appreciation of this address, and so as to save time, I shall reflect on 2 major areas which will include institution of legal action against NHIA and related organs, then the welfare of the public sector health workers in the employment of the Lagos State government. So quickly, let me address the institution of legal action against NHIA and related organs. It was sometimes in 2006 that one of the most successful health ministers in contemporary times in Nigeria, Professor Eyitayo Lambo, actualized the concept of social health insurance in Nigeria under the framework of change agents at the Federal Ministry of Health. Most stakeholders figured at that point that the appropriate implementation of the erstwhile National Health Insurance Scheme will be the instrumentality to address the many years of distorted and mutilated configuration of professional services in the health sector. For us in the Pharmaceutical Society of Nigeria, Lagos State, we just presumed that deliverable will get to the consumers of health and that there will be an equivalent spread of benefit packages, rights, and privileges to the respective constituents in Nigeria's team of care providers. But it all proved to be a charade, as the inevitable status quo of only one player perennially superintending the Commonwealth of Health Workers was only redefined and consolidated to the advantage of one profession in a multidisciplinary sector. This started as the Committee of All Health Professionals, which midwife the National Health Insurance Scheme procedure, submitted its report. That report had made vital recommendations which produced the first operational guidelines in the implementation of social health insurance in Nigeria. The lawful provision of the National Health Insurance Scheme, that is the Act, that still subsists is that the scheme the authority recognizes only 4 payment mechanisms, which are capitation for primary providers, that is the physicians, fee for service for secondary providers, that is pharmacists and consultants, then per diem and case payment. In tandem with these payment mechanisms, the agreement in the report stipulated that each registered care provider must sign a service agreement with the HMOs, who are widely perceived as the drivers of well-implemented social health insurance programs. From inception in that 2006, the then National Health Insurance Scheme, that NHI's Secretariat, in active collaboration with the HMOs, violated the NHIS Act by adopting an unlawful concept dubbed global capitation. But I'm glad now that Lashman is now doing what we have been asking for, which in real terms implied that the HMOs, this in real time implied that the HMOs were allowed then to disburse funds meant for fee for service for pharmacists who dispense drugs or laboratory services in the area of diagnosis by laboratory scientists, in addition to the capitation fees of primary providers to the same physicians. This obnoxious and oppressive act was protested, and in some states this actually is still going on. But fortunately for us, now that Lashman is towing the line, we want to congratulate the PAMSEC and Lagos State for this. From 2006 to 2024, there have been 15 dialogue sessions by the leadership of PSN and ACPN. ACPN is actually Association of Community Pharmacists in Nigeria, with successive management teams of NHIS, now NHIA. But after rigmaroles as well as manipulations, the ugly status quo was not just retained but actually perfected. When the current management team of NHIA came on board, fresh consultations were initiated, and only retro that emerged was the NHIA will not embrace global capitation because it is not provided for in that NHIA Act. From an operational point of view, this was proven to just be semantics, as NHIA continues, in so many states, to merge funds meant for fees for service for our members with capitation payments for physicians all around the country. The PSN Lagos State, in conjunction with stakeholders and the ACPN, has continued to review particularly this development. And, we are looking at it from the legal point of view so that at least the court of law will be able to make a pronouncement, majorly even because of the PSN Act of 2022, which combine to make it very unambiguous that dispensing of drugs cannot lawfully be handled in any facility that is not registered by the Pharmacy Council of Nigeria. While in similar spirit, the law forbids dispensing of medicine by persons who are not registered pharmacists within the purview of this PCN Act 2022. Fundamentally, we have gotten to a point where we must determine where drugs used in NHIA are dispensed from. Who are the persons who dispense the over 1 trillion worth of drugs paid for by the federal government since 2026? Are they all registered pharmacists? In more recent times, some of the very mischievous state platforms charged with implementing social health insurance has actually attempted to officially inculcate patent medicine dealers who are not trained to dispense drugs and who are meant to stock only OTC medicaments into the insurance programs in their states. The provisions of the law notwithstanding, the development bordering on such brazen impunity and aberrations demand that we protect consumers in Nigeria from the unending aberration of some of our policy makers. Distinguished guests and colleagues, I find it necessary to inform you that we are left with no choice at this crucial stage of pharmacy evolution in Nigeria than to encourage the appropriate platform to invoke the resolution of the annual general meeting of the ACPN just a few months ago, which mandated us to seek legal intervention in many anomalies of the implementation of health insurance in Nigeria. I therefore confirm to you that the attorneys general of the association will join stakeholders in the process of instituting legal process against NHIA and other related government apparatus to compel a redress in the unwholesome mess that continues to epitomize managed care and social health insurance programs in Nigeria at the Federal High Court in Abuja. This becomes germane because the state governments and private insurance schemes continue to leverage on the obnoxious model of NHIA, an addendum which we must nip in the bud now for the sake of posterity as we seek the norm in international best practice, even for Nigeria. Let me quickly go to the welfare of public health workers in the employment of Lagos State. The Pharmaceutical Society of Lagos State, we are compelled to continue to bring this issue even to the general public and government, because as far back as 2023, May 2024, which is over 1 year ago, Joesu and APA, gave Lagos State some, a few ultimatums, and some of these agreements, we continue to wait endlessly, even for the government to implement them. So we therefore enjoin the government to magnanimously implement some of these agreements. Let me just read out some of it to you. Payment of hazard to members of Joesu, domestication of consultancy cadre in pharmacy, retention allowance, upward review of enhanced call, shift and non-clinical duty allowance, circular on the headship of the Directorate of Medical Laboratory Science, implementation of call duty allowance to dental technologists, therapists, implementation of full Con-S salary scale. The agreement was on May 2024, 2023, and 15 months after the government of Lagos State is yet to implement all these agreements. Let me speak on the consultant pharmacy cadre. That has actually been something that we have actually clamored for, not because it is a Lagos State-based or a Lagos State issue, but these are best practices all over the world. And I'm sure as many of us that travels abroad, we see even in places like just Ghana, Togo, that they have pharmacist consultant and they are recognized. So it is not like we are asking for things that, is out of place. These are best practices all over the world. It has become fully operational at federal level with the creation of necessary elements. Just recently, IPPIS payments platform for consultant pharmacists. And with this development, over 250 consultant pharmacists have been appointed in the last few weeks by federal health institutions, with University College of Ibadan leading the way with the appointment of over 30 consultant pharmacists. Lagos State is the center of excellence, and actually I expect that it is in Lagos State that people will copy us. They copyright things, the good things, best practices all over the world. It shouldn't be that it is Lagos State that will now be left behind, because you will find out that in all the southwest states have recognized pharmacist consultants, and they are now working. It's only in Lagos State that we are yet to recognize pharmacist consultant. So, in conclusion, the Pharmaceutical Society of Nigeria, Lagos State, once again advises and appeal to the Lagos State government to expedite action on this lingering agreement and other fresh ones. And we expect the Lagos State to, if there is any problem, to call on stakeholders so that we can actually move forward in this area of consultancy, pharmacy, and other health issues that we have actually intimated the governor with severally. So finally, I wish to enjoin pharmacists to explore the knowledge and informations which has been on display since Monday, to strengthen their practices and our profession as we continue to strategize to maximize therapeutic outcomes in public interest in the months ahead. You see, the week started on Monday. The APS, that is Association of Lady Pharmacists, they were at Makoko, Makoko area, where they intervened and they gave even free medicals, free health care services to over 250. And they have over 250 pregnant women with their medication. Even some of the things they will need, during delivery, we were able to donate it to them. So, and on that Monday too, the Association of Community Pharmacists, they were in about 12 locations across the state, intervening in the medical issues that people come with, because some of these people, they are not able to get health care, maybe because of the insurance that we are still talking about, people paying for their medications and all that. But we are able to intervene, and cases where they needed to be referred to the doctors, to general hospitals and primary health care, we did all that, and they are documented. Yes, on Tuesday, the hospital pharmacists, they gave, they They gave us part of what they have been doing, even in the hospital, some of the interventions that they have, the reasons why pharmacists must continue to be in the hospitals. And if some of these things, we are going to publish them, and we are going to make sure that, we know even the rightful place of the pharmacists in the healthcare delivery system. So thank you all for coming to this program. And as we listen to the keynote address speaker, God bless you. God bless Nigeria. God bless Pharmaceutical Society of Nigeria. And God bless Lagos State. Thank you very much. Yes, this just came in that there are about 100 new enrollees on apps, on that day, on Ilera Eco Standard Jara platform, because of the program that was held on Monday. Thank you very much.
A round of applause for the chairman, PSN Lagos State.
Thank you, Mr. Chairman. One more time, I want to sincerely appreciate the representative of the governor of Lagos State, Dr. Emanuela Zamba, Permanent Secretary, Lashma, Lagos State, for your presence in your capacity as representative of the governor and your personal office. Thank you very much for coming. Now we shall be listening to the speech of the PSN president, ably represented by the National Secretary, Pharmacist Gafar Madein, FPSN. But before we do that, as is customary, we are going to invite APS, who will be led by our own fellow pharmacist, BFO Adeniro, FPSN. All APS. Up, APS.
Excellence and service.
Fantastic. So be upstanding and please, you can come up.
All Appians in the house, please come forward as we sing the PSN anthem.
I will also join you as an Appian. Please, can we come up? Please, you can.
All pharmacists, please, could we be upstanding
as we sing our
while the
pharmacy
Alpians
anthem.
come forward to lead the national anthem? PSN anthem, sorry. We have it on page 5 of our program. The pharmacy anthem is on page 5 of our program. Yes. Please, let's showcase our choir.
All right, 1, 2, go.
1, 2, go. We pharmacists, we're proud of pharmacy. We members all of the glorious PSN, Pharmaceutical Society of Nigeria. As men of honor, we join hands for pharmacy. Pharmacy.
We are the
health sector.
We are the
industry.
We are the
counseling.
We are the
drug detailing.
We are the
education.
We are the
Answer 4. We pharmacists, we are for cooperation with members all of our great nation's health team. Safe pharmacists will guide our nation's health, and we prove that pharmacy can hold its own everywhere. Pharmacy,
We are the
health sector,
We are the
industry,
We are the
counseling,
We are the
education,
We are the
all sectors.
We are the
Just name it.
We are the
Nigeria.
We
are there.
Thank you very much. A round of applause for the Albion Choir.
This is a call for show. Can we clap for Pharmacy Lagos? A call for show.
No, it's not a call for show. It's a call for action.
A call for action. Okay.
Yes, so.
All right. Please, let's be comfortable, sisters, as we invite our president. When I didn't hear, I was going to ask. I didn't hear MC Job. We are there. When I heard all sectors, and they said, just name it, and I am naming in it. So, Mr. President, you have your microphone, sir. Let's give our president a round of applause, maybe represented by our National Secretary, Pharmacist Gafar Madei, FPSN. Thank you.
Thank you. Good morning, everyone. I want to, first of all, stand on the existing protocol because the time is fast spent. I cannot start recognizing individuals again. They have been recognized already. So I want to stand on that existing protocol. I want to state clearly that the president of Pharmaceutical Society of Nigeria, Professor Cyril Odianose Usifo, would have loved to be here. As you know, since he became president of the society 3 years ago, he has never missed events of Lagos PSN. But he is unavoidably absent today because he's not in Nigeria. You know, he traveled to UK for an important event. And from there, he will be moving to South Africa for the FIP conference. So that's why he's not here today. And that's where I'm standing forth for him. But his spirit is here. We discussed this morning, and he expressed his congratulations to PSN Lagos for a successful pharmacy week, which started on Monday. The theme of this year's pharmacy week, the imperatives of the march towards achieving universal health coverage in Nigeria, is very, very apt and very, very important. As the chairman of the occasion mentioned, universal health coverage can only be achieved if we look inward, to our society. And again, if we recognize that quality health care can only be achieved if the practitioners that are involved in the delivery of this health care are well taken care of, if there is equity. And just like has been said before, I want to give kudos to Lashma, for blazing the trail. Lagos State has always been known to be trailblazers. And most of the national programs usually start from Lagos. And other states copy and even federal government copy. But there is one thing that Lagos State has missed the opportunity of being the trailblazer for, and that is the recognition of consultancy cadre for pharmacists. The opportunity came, but they missed it, because currently federal government has already recognized this consultancy cadre, and for your information, the allowances for consultant pharmacists in federal health institutions has been integrated into the payment system, IPs. So which shows that, federal government is ready to implement it. And for Lagos not to have started, it's like they are now allowed federal government to take the sale of them, which is not the usual price. We know Lagos to always be in the forefront. So I believe that our amiable governor will get this message, and do the needful, in the area of recognition of the consultancy cadre for pharmacists. Because it is by this recognition and also recognizing the services of other healthcare workers that we motivate the healthcare team, to bring forward the quality healthcare that is needed for universal health coverage. So I will not take too much of our time. I want to use this opportunity again to, on behalf of the President, to congratulate Pharmaceutical Society of Nigeria Lagos State Branch for a well-organized pharmacy week. And we pray that in the coming years, we all be healthy and sound, to be part of the future programs and of Lagos State PSN. So thank you very much and congratulations.
A round of applause for the PSN president, ably represented by pharmacist Madein Gafar. Thank you very much, sir. All right. We'll be calling on the representative of our governor of Lagos State, the Center of Excellence, in the person of Dr. Emanuela Zamba, the Permanent Secretary of Lashma Lagos State. Let's welcome her with a round of applause. While we are upstanding, we'll also take the national anthem in honor of our great country and state, Nigeria and Lagos State. The national anthem, media, just the first standard, please. You're welcome.
Nigeria, we hail thee, our own dear native land, through trials of many differ, in brotherhood we stand. Nigerians forever to serve our supreme motherland.
Thank you very much.
Good morning. Is it still morning? Oh, excuse me. Good afternoon. Thank you very much for the invitation. I bring warm greetings from our governor, Mr. Babajide Olusola Sanwo-Olu, who would have wanted to come himself, but has sent myself and the SSA to ably represent him today. Before I dive into reading his speech, I was also invited as a special guest, so maybe I'll say a few words for Lashma. I was getting alarmed when our chairman was talking about the event at Makuku, and I didn't hear anything about the fact that Lashma and Ilira Eko were there, but thankfully, he said it at the last minute. So just to show you that in Lagos State, we value our pharmacists, and Lashma in particular is always ready to partner with the pharmacists in Lagos State. There was also about the comment around whether Lagos State is for show or for action. We're actually for both. We're both show and action. Thank you for the kind remarks around the work that Lashma is doing with the community pharmacists in Lagos State. Our chairman of the occasion talked about remodeling the model. Lashma is proud to be blazing the trail in the health insurance space. I will continue to work towards ensuring that everybody is encompassed. Thank you. So, on behalf of Mr. Babajide Olusola Sanwo-Olu, I will read his address for today. The chairman of this laudable occasion, who is the chairman, Hazon Holdings and managing director, Wellness HMO, pharmacist Victor Afolabi, and his wife, pharmacist Adetutu Afolabi, the senior special assistant on health to the governor of Lagos State, Dr. Oluwatoyin Adeyemi, the keynote speaker, who is the President-elect Nigeria Association of Pharmacists and Pharmaceutical Scientists in the Americas, NAPSA, pharmacist Dr. Adekunle Tometi, the President, Pharmaceutical Society of Nigeria, PSN pharmacist, Professor Cyril Usifo, FPSN, ably represented by the Secretary, Pharmaceutical Society of Nigeria, pharmacist Gafar Madein, FPSN, the Chairman, PSN Lagos, pharmacist Babayemi Oyekunle, MAN, the past President, PSN, pharmacist Olumide Akintayo, FPSN, the Dean, Faculty of Pharmacy, Lagos State University College of Medicine, Professor Adeleke Clement Adebajo, the Dean, Faculty of Pharmacy, University of Lagos, Professor Gloria Ayola, the Chairman of other medical professions here present, the Chairman, Technical Arm and other interest groups, other pharmacists here present, gentlemen of the press, distinguished ladies and gentlemen. It is a profound honor to be here today at the 2024 Scientific Week celebration of the Pharmaceutical Society of Nigeria, a gathering that not only reflects the commitment of our nation's pharmacists to advancing healthcare, but also serves as a crucial platform for dialogue on matters that are pivotal to the well-being of our people. The theme of this year's celebration, the imperatives of the march towards achieving universal health coverage in Nigeria, is particularly timely and significant. It speaks to the core of our collective mission to ensure that every Nigerian, regardless of their socioeconomic status, has access to quality healthcare services. Pharmacists are a cornerstone of the healthcare system. They are the custodians of medicines, the guardians of patient safety, and the advocates for rational drug use. As we march towards universal health coverage, the role of pharmacists becomes even more critical. It is through your expertise, your dedication, and innovative contributions that we can ensure that medicines, one of the most essential components of healthcare, are accessible, affordable, and used effectively. Today, I stand here not just to commend your efforts, but to reaffirm the commitment of the Lagos State government to supporting the pharmaceutical profession and advancing the goal of UHC in our state and beyond. In Lagos State, we recognize that achieving UHC is not just a goal, it is a necessity. It is the bedrock upon which a healthy, productive society is built. Over the years, the Lagos State government has taken decisive steps to strengthen our healthcare system, ensuring that it is robust, inclusive, and resilient. To ensure that every Lagosian has access to affordable healthcare, we launched the Lagos State Health Insurance Scheme. This scheme provides comprehensive coverage for a wide range of medical services, including consultations, treatments, surgeries, and medicines. By subsidizing the cost of healthcare, the LSHS makes it possible for even the most vulnerable in our society to access quality medical services without financial hardship. We have invested significantly in the development of pharmaceutical infrastructure across the state. This includes the construction and renovation of state-owned pharmacies, ensuring that essential medicines are available and affordable in every corner of Lagos. We have also strengthened the supply chain for pharmaceuticals to prevent stockouts and ensure that our citizens have consistent access to the medications they need. This administration has fostered a strong partnership with the Pharmaceutical Society of Nigeria, and this collaboration has led to the implementation of various programs aimed at improving pharmaceutical services in the state, including continuous professional development for pharmacists, regulation of drug distribution, and public health campaigns on the safe use of medicines. We have also placed significant emphasis on revitalizing our primary healthcare centers, which serve as the first point of contact for many citizens. By equipping these centers with essential medicines, trained pharmacists, and other healthcare professionals, we are bringing healthcare closer to the people and reducing the burden on secondary and tertiary healthcare facilities. Furthermore, we have invested in the continuous education and training of healthcare professionals, including pharmacists. We have supported research initiatives aimed at addressing public health challenges with a focus on developing innovative solutions that can be scaled across the state and beyond. In collaboration with the PSN and other stakeholders, the Lagos State government has embarked on numerous public health campaigns focused on promoting preventive healthcare, vaccination drives, and awareness on non-communicable diseases. These campaigns are crucial in reducing the prevalence of preventable diseases and ensuring that our citizens remain healthy. While we have made significant strides, the journey towards UHC is ongoing. It requires continued collaboration, innovation, and commitment from all stakeholders. The Lagos State government remains resolute in its mission to provide equitable healthcare access for all and will continue to support the Pharmaceutical Society of Nigeria in its effort to improve the health outcomes of our people. As we reflect on the discussions that will take place during this scientific week, I encourage each of you to think about how we can collectively accelerate the march towards UHC. Let us leverage our knowledge, resources, and networks to build a healthcare system that truly serves every Nigerian. In conclusion, the Pharmaceutical Society of Nigeria plays an indispensable role in safeguarding public health, ensuring the rational use of medicines, and advancing the broader goals of our healthcare system. Your unwavering commitment to professional excellence, public health advocacy, and continuous innovation has been instrumental in our collective journey towards achieving UHC. I extend my deepest gratitude to the PSN for your tireless efforts and your collaboration with the state. I would also like to specially appreciate the leadership of the society for their visionary guidance and the organizers of this event for their dedication in bringing together such a critical dialogue. Your efforts are pivotal in shaping a healthier and more prosperous future for all Lagosians. Thank you for listening, Mr. Babajide Olushola Sanwo-Olu, Governor of Lagos State, on this day, 29th August 2024. Thank you.
Thank you very much, Your Excellency, the Governor of Lagos State, ably represented, very, very ably represented by the Permanent Secretary, LASHMA, Dr. Emanuela Zamba. And we want to say thank you for answering our prayers. All requests answered. Thank you, Mr. Governor.
A round of applause again for our governor. Lagos is still blazing the trail and will continue to blaze the trail.
Just as the program is going on, we have some of our guests, colleagues from other parts of Nigeria. We want to recognize the presence of pharmacist Tanko Ayuba, PSN, pharmacist, welcome, pharmacist Abiodo Ajibade, FSM from Oyo State. We have pharmacist Ogutoyo Adeboyega, MW, Secretary of, that's the chairman. Is he around?
Yes, he's around.
Adeboyega.
It's another Abu site.
Yeah, welcome.
A round of applause for him again.
Pharmacist Adedayo Akala, General Secretary of PSN Lagos, Oyo. And we also have in our midst pharmacist Mrs. Chief Yetunde Morondia, the Vice Chairman, Board of Fellows. So we shall be inviting the governor back to the stage to declare this event open. We also have in our midst, yes, my sister, pharmacist Ejiro Foyibo, FPSN from Ogun State. My state. No vex. So you're welcome, ma. So we want to welcome the governor to declare this event open.
Thank you once again. Just to say that we were listening with rapt attention when the chairman of PSN was speaking. We have taken due note of all the contents and the asks. We will take it back religiously and give your messages to Mr. Governor, and I'm sure you will be hearing from Lagos State pretty soon. Thank you. So, having said that, I wish to, on behalf of Mr. Babajide Olusola Sanwo-Olu, the Governor of Lagos State, declare this scientific week open for the glory of God, for the honor of science, and for the benefit of all Lagos residents as we march towards UHC. Thank you.
Can we be upstanding, please, as we give the governor a round of applause, please? I told us all events before now were closed doors. Now it has been declared open. You can now begin to share all events before now. Thank you. We are now let's appreciate our journalists, photo and news. Thank you very much. We acknowledge the fact that the governor has a very tight schedule, and we are not taking this for granted. Thank you, Your Excellency.
A round of applause once again for her.
We also appreciate every member of the team of LASHMA, so you are welcome. Have a pleasant day.
All right, we'll be having the keynote address. But before the keynote address speaker comes up, we'll be inviting pharmacist Yimika Oguns, a senior brand manager in EMZO, to take the citation of our keynote address speaker. Please can Pharmacist Yimika come forward to take...
And the keynote speaker also, please.
I've been told she's ever ready. All right, you're welcome. A round of applause for her. A round of applause for our keynote speaker to as he comes forward, Pharmacist Adekunle Tometi, PharmD, FPSN, FNAPSA, and FNAFAM. A round of applause for him again.
Please, we apologize. The chairs I think we've exhausted the space. Just create room for your colleagues as they take more chairs in. Thank you very much.
Mr. Governor in absentia, the PSN President, duly represented, Chairman PSN Lagos State, past Chairman, past Presidents, Fellows of Pharmaceutical Society of Nigeria, and all other protocols duly observed. I would be taking the citation of Pharmacist Adekunle Tometi, PharmD, FPSN, FNAPSA, FNAFAM. Adekunle Tometi is a high-energy manager, successful in building and motivating dynamic teams. He cultivates a work culture where team members feel comfortable voicing questions and concerns, as well as contributing new ideas that promote people and organizational growth. With over 30 plus years experience in multi-unit managerial and business planning, he has strong strategic planning and people management skills. He's also an excellent advocate for good pharmacy practice, committed to pharmacist empowerment in the USA and in Nigeria. He had his first degree from the University of Ife, Great Ife. And then in 2020, got his Doctor of Pharmacy from the Howard University, Washington, D.C. His work has cut across different places and currently works globally to develop and continue to use his different skills to deliver great results across leadership and operations management, time and resource optimization, communication, analytics, and organizational skills. He remains a strong force in mentoring and precepting young pharmacist professionals in performance management, talent acquisition, and team management. Another aspect of his work also cuts across clinical community pharmacies development with a strong commitment to advocacy and advancement of the pharmacy practice globally. Adekunle Tometi loves to serve, and some of his services to the profession includes working on the Public Policy Council and Finance Affairs Council, and also as a member of a 3-man audit committee of the Texas Pharmacy Association. He was also the NAPSA representative on the PSN NEC between 2019 and 2023, and is currently the president-elect of NAPSA. Some of his awards that he has received includes the Fellowship of Pharmaceutical Society of Nigeria, a Fellowship of the Nigerian Association of Pharmacists and Pharmaceutical Scientists in the Americas, NAPSA, and is also a Fellow of the Nigeria Academy of Pharmacy, NAFAM. Ladies and gentlemen, men of honor, I present to you the keynote speaker for today, Adekunle Tometi.
Thank you very much for the opportunity to be here today. I always like to talk within the people and not stay up there because I am really not that person they were reading all that stuff for. I'm a very proud pharmacist, a Lagos pharmacist, because my license is actually here at Lagos State PCN. I see giants on whose shoulders I'm riding on. I see my very senior colleagues at Great Ife. Greatest Gbogbo. I can see Victor and Adetutu looking at me like, what is going on? It's good to see Victor and Adetutu. They were in my 2021 MAW class. Yes. And I continue to follow your career and the great things you do. We're very, very proud of you. And thank you very much, ma'am, for the support. I'm being asked to speak on the imperative of the march towards achieving universal health coverage in Nigeria, the pharmacist perspective. What we're going to try to do today is to define universal health care. We'll try and look at the goals of universal health care. We will look at the dimensions of universal health care. And then we'll look at 10 practical imperatives that pharmacists can participate in to advance the cause of pharmacy and also add value to universal health care. At the end of this, we'll have time for questions and answers. But as you go through these slides, you saw in my citation, I'm somebody who like to encourage team members to offer new ideas, provide solutions. I like community-based decision-making rather than be the boss. So as you see the slide, if you think you have things to contribute, please feel free to raise your hand and contribute to this. I hope we can get all this done in 30 minutes. Let us start by trying to define universal health care. Sometimes it's called universal health coverage. It's actually a healthcare system in which all residents of a particular country or region are assured of access. That is the main word, access to health. Its goals are really two. Number one is as we give people access to health, the chances of improving health outcomes in the community are increased. The second thing, like Victor mentioned earlier on, cost. The goal of all of this so that that program continues to remain and continue into perpetuity is assuring that cost is reduced. So, like I mentioned earlier, the most important thing is access, but it is important that we all need to know that when we talk about cost, it is reducing hardship. In some countries, like where I practice, everybody is mandated to have health insurance. Where in my practice, when I owned my business, I provided health insurance for myself, my family, and everybody that works for me. It cost our practice, I think, $2,500 a month to get that done. And the reason why we do that is so that we can reduce the hardship on our staff and on ourselves, to the point that you go to see a doctor, you go to get your prescriptions, you pay hardly nothing. Some of this cost, you don't see it very often. I'm sure a lot of speakers here have tried to talk to that. There's some back-end cost that your organization or the government does cover for you. So in some countries, it is mandated. In some other countries, government pays a lot. The government pays everything. But whichever hybrid case there is, it is important that all of us take ownership of our health, because a productive country is one with a healthy population. Now, what are the three dimensions of universal health care? Number one, who is covered? And this is where we need to start wearing that different heart. That heart that's not about the custodian of medicine, but we got to start thinking about how do we key into this? How do we add value? If you are a business person, think about how do you get on the program? How do you make money for your organization? If you're somebody in practice, how do you improve health outcomes? So the first dimension is who is covered. Patients are covered. Providers are covered. Services are covered. As the population continue to need more and more and more services, not all services are covered. Some are essential, and some the patient will have to pay a little bit more out of pocket. What services are covered? There's medical. You go to see a doctor. diagnosis what is wrong with you. Understand that where I practice, there are defined lines and defined rules of how people practice. We don't cross into the other person's lane. So there's medical, there's pharmacy. Equipments are also covered. You need a wheelchair, you need an oxygen tank. All of those things are covered. Many other things. How much of the cost is covered? I said most, if not all. It depends on who is paying for it. But in all of this, pharmacist and pharmacy, we can add value to these three dimensions. So let us pivot straight away to the pharmacist perspective on universal health care. We can look at 10 different imperatives where each of us can play a role. And as pharmacists and as professionals, we need to start thinking outside of what we're used to. I'm a business person. So at the end of the day, as I think dollars and cents, I think value, but more importantly for me is, hey, does it really pay for my time and does it pay for the team? Number one, accessible medication. We need to ensure that medications are affordable and accessible to everyone. You might be in NAIP, in the industrial practice pharmacy. I have 8 NAFDAC-approved products in this country with my company that I sell, although I packed it aside for a while because my wife said I was getting too old. I need to build our house here first, so I did that first. So we're going to get back into reviving that company and starting to sell again. One of that product is called metformin. I was talking to a CEO, I think it was Shalina, a few days ago, say we can have a partnership if they can take the marketing rights of those products away from us and just pay us a stipend as they sell. Because nowadays you have to collaborate to find ways to continue to stay in business. And then I discovered, or they told me that metformin, one of our products, it's no longer a product that we can make outside of the country. So in things like this, where we talk about medication affordability and accessibility, for those of you who are not in retail, maybe you are in the industry, you play a particularly important role in the manufacture of products that are here within the country that has to be made. Paracetamol. You heard during the COVID period about medicine security, where some countries banned the exportation of some products away from their country because they needed it. So as a member of other fields that is not necessarily ACPN, NAIP, this is where you can key in to be sure that in your work, you're working towards making sure that medicine is available. And the more of it that is made here, I believe without all the need for forex, the cheaper it will be for the consumer. Pharmacists also play a critical role in what we call medication therapy management. When people get older, there is need for them to take more and more and more medicines because they now have chronic medical conditions. I've seen cases where a patient takes 15 different medicines, but by the time you bring a pharmacist in, he looks at all the profile, look at the disease state, he can see all the tests and everything that the patient needs in order for them to be able to make a good clinical decisions. We've seen cases where we're helping to reduce costs by reducing that many medicines because firstly, there's duplication. Secondly, there's some that they're being prescribed to take care of a side effect of one other one. And you can trim this down and make yourself of great value as you help manage people's medication. And we want to assure that patients need all the medicine they need. There are instances, I'm also a compounding pharmacy, where people cannot take a particular kind of medicine because one, they have allergy either to the drug, have allergy to the dye, it is not commercially available, and all of these things. As a pharmacist, you can add value in the universal health care if you are, in fact, a compounding pharmacy. The next thing is what we'll call comprehensive coverage. We talked about NTM. We talked about prescription medicines, value-based preventative care, and chronic disease management. Pharmacies actually, in the U.S., some pharmacies have chronic disease management clinic where the pharmacist work in collaboration with a physician, specialists in that group. And pharmacists are the ones who actually clerk the patient. They're the ones who make decisions on changing the medicine and assuring and monitoring that the patient gets better, because all of these things are evidence-based. Also to understand that where I practice, we do have guidelines on how we treat different kind of diseases. So you hardly ever go out of guidelines in what you're prescribing. The third is integrated care. We practice collaboratively. My collaborative physician, he has retired. Dr. Edo is actually back in Nigeria now. I saw him yesterday. And if he is not in the office and a patient comes that has seen me before, he can easily send me a text and I'll take care of that patient. If it is simple things like blood pressure, to adjust their blood pressure medicine. Or I'm asking them, hey, you're in the office, you're diabetic. When was the last time you had your blood glucose level checked? I can do that in my office. I can adjust his medicine. I can take one away. I can add one away. And I can CC him. These are the things that I've done. So there is a lot of role for us pharmacists. But it is important that we get the education that will back us in all these decisions that we would make to help improve health outcomes. Education and counseling. I mentioned it just a few minutes ago. When I left Nigeria with the opportunity to go live and work abroad, I left here with a bachelor's of pharmacy degree. It's the toughest 4 years. I see all these pretty women singing this Alps National. I'm like, where were they when I was in school? I was in school, but I wasn't seeing nobody because the course was just so damn hard. And my practice as it's evolved, and, healthcare is continually changing. Responsibilities of pharmacists are improving. You have something here called TSTS, tax sharing and tax shifting. Thank you. More roles are being ceded to pharmacists. In order for you to effectively practice at the top of your license or to effectively practice in that role, you need to get more education. I spend a lot of money. One of the reasons why I'm very grateful to Nigeria and why I still am a very proud Nigerian pharmacist, I tell myself that my biggest honor is to be an FPSN, not the other fellowship. This is the only one I ever wanted to be. And all those years, I can say that I almost went to school for free. 3 years of a doctorate degree cost me $80,000. So we all have to take advantage of the opportunity we have in this country. It's important that we get more education. When you do get a patient, somebody with an advanced degree in pharmacy practice, the way you speak to the patient, your reception of the patient, beginning from getting all the data, from listening to them, it's totally, totally different. For those who have this advanced degrees, they will tell you the way they practice now is not the way they practice years past. So it is important as we celebrate our dean here today. I thank you very much for the work that you do. That each of us aspire to improve on our education to be able to practice at the top of our practice. I was speaking at NAPA last week as the keynote speaker, and one of the things I challenged them, that's Nigerian Association of Pharmacists in Academia, is there is a lot of resources amongst all these pharmacists practicing in regulatory, practice in the community, and business people like Victor here, that you can bring these guys into your school to talk to the pharmacy students. Maybe once a year. I'm sure most of us will do this pro bono. We'll do this pro bono. The reason why my first job I was a rep is because the first pharmacist that I saw that actually talked to me about pharmacy was a rep. And we continue to have students that are underperforming, not because the lecturers are not teaching, but there seems to be a disconnect between academia and the practice. And we can all bridge this, where we have people here who are more than happy to go back into the colleges and teach for an hour, teach for 2. Myself and Professor Babalola, I remember when we went to Ife, our 25th anniversary of leaving the college. Went to see what the pharmacy school was like. I was so shocked that, my God, it's like seeing a 504 nowadays. Like, did I write in that thing? Yeah, so I was so shocked how bad the labs were, to the point that I offered that in my compounding lab, because we now have AI, we can use all of those things. We can simulate, okay? We can simulate teaching, okay? We can, while I'm in the lab, I remember doing videos for her, how I make suspensions, how I make this, how I make that, for her to play to our student. Because the days when you and I were in school, you had a whole cubicle for yourself to make all the compounds in the world and throw all those things away. They don't have that anymore. So please, my dear professor, I ask of you today, we have people who are in pharmacy administration. My elder brother, Olumide Akinjobi, is here. Those people have been fighting for advocacy all day, even from Ife. See, we have ABO is here. That's his partner in crime. All the way from Ife. Pharmacy advocacy itself, the pharmacy practice cannot subsist without advocacy. I spend a lot of time on advocacy now because if we can't show value in what we're doing, pretty soon we might be overrun. Pharmacy is the only healthcare business, I think, that has goods attached to it. If you go see a doctor today, you probably keep you waiting in one room for 1 hour. By the time he comes to see you, you've forgotten why you are there. If you remember and you tell him, he sees you for 5 minutes and that's it. And then you get a bill of thousands of naira or so in your home. At that time, you're not even able to challenge him. But you go to the pharmacy, they give you 20 pills and tell you it's $10,000. Immediately you do that calculation. 15 naira for one tablet. See? So you understand why people seem to respect whatever the doctor tells them, because they cannot conceptualize or they cannot put a price to service. But whatever you do as a pharmacist, especially in the retail outlet, they can actually immediately do the calculation. And that is why all the speakers today have been telling us that we need to do more than that. We need to change our mindset. It shouldn't be about just counting pills. It shouldn't be about labeling pills. But we should be able to counsel patients, educate them, such that they will see our value much more than counting tablets. In America, every new prescription, we don't even sell, we don't sell any medicine without a prescription, no matter how close you are to me. If you come, you need this, no problem. Let me call my collaborating physician, go see him, then he will send the prescription. Every new prescription that comes to our practices, we must, it is the law. You must counsel the patient on every new prescription. So you see that pharmacists are spending 5-10 minutes, it continually, it challenges your head. You have to keep reading. For myself, I never practiced without interns. And over the last 24 years, I've had 20 Nigerian pharmacists from here, the Japa people. I'm the original Japa one. I've had 20 of them that have come from here that are licensed now in the U.S. that have gone through me. I take pride in making sure that I help my people settle in. I help my people advance their knowledge so that if we're better over there, some of them can begin to come home like I am doing so that we can help improve and impact our practice here. Number 5 is preventative health. You will see that some companies only recently left Nigeria. Glaxo is an example. I worked at Glaxo from 1990 to 1994. And then we were selling a lot of Ventolin, a lot of, call it Zenat. I think the last molecule that came out when I was there was ondansetron, Zofran. But if you look over the last 10 years, in all this big pharma, the number of new molecules coming out from these companies have reduced. The reason why this is happening, coupled with the fact that every 8 to 10 years we get a new pandemic. It looks, as long as there's China and they're eating everything in the world, we would always have a pandemic. Because of that, these companies have intelligence from all the field. And you will see, an example is Pfizer. Over the last 4 years, they've more than doubled their income in terms of what they bring in, not because they brought out any new molecule. An example again is, if you bought shares at Moderna 4 years ago, today you would have your money at least quadrupled. What are they doing? People are moving away from new molecules and they're going into what? Immunizations. Immunizations and vaccinations have saved the world a lot of deaths, a lot of diseases, because you can actually prevent people from getting sick from all these diseases that are available all over the whole place. If you talk about polio, for instance, there was a time it was a big thing because of vaccines and because of people like Geo and the Rotary four-way test. They've done very good work in making sure that we all get all our vaccines and we're all better. I mean, we're thankful for Nigeria because during COVID, we all wondered, how is Africa going to deal with this? But COVID itself being a coronavirus, there's a lot of coronaviruses everywhere. That your secondary immune response, I think that's what the prof taught Lami Conrad, the secondary immune response. He taught us that now. Because of the exposure, people have immune response to those things. So for each of us that are pharmacists here, and I'll ask the prof again, prof, in all the curriculum, in pharmacy schools, I believe across the globe, but in America especially, pharmacists delivered immunization is one of the credit courses that all pharmacy students must pass through before they graduate, so that when they are graduating, they have all the skills and knowledge to do immunizations. It's part of the system now. I just wanted to say that. Good. It's part of the curriculum. Because this is what we find out, that in universal healthcare, the curriculum in schools where pharmacists are trained, for the people who really need that in their curriculum, they don't have it. We have it a lot around the world, but in Africa, for instance, where we need all the vaccines to help with preventive diseases, they don't have it. I'm thankful that I was one of the faculty, the team that brought pharmacist-based vaccination delivery to Nigeria, and we've trained over 400 Nigerian pharmacists, some of them sitting in this room, on how to give vaccinations. And of course, there's health screening. There are a lot of people, like Victor said earlier, people just walk and they die. It's not one of us, not two of us that you've heard. Somebody died. He was okay yesterday. He wasn't okay. His blood sugar might have been way off. His blood pressure, he died in his sleep. Why would he die in his sleep? Over here, you always say it's God's time. It's not God's time. It's not God's time. It's people do not own their health condition. I give you one thing that I do for myself. I always have an annual medical checkup on failing. And you know, when I do it, I tie it to a life event so that I don't forget. I do it on my birthday. 7 a.m., 2 weeks before my birthday, I go to my doctor. I give blood for the chemistry. But on my birthday at 7 a.m., I'm in the doctor's office. We're discussing the chemistry. And then he tells me, oh, your blood sugar is good, but you're borderline this. You need to cut that off. Your blood pressure is good. We discuss a whole lot of, and that gives you, I acknowledge all of us here, that you've got 1 year. If you do this annually, you've got 1 year to get your health right. It's better for you to do that than for you to assume that, okay, I'm healthy. It's like a couple. The ones that fight all the time, that call you to come and settle them, they never divorce. It's those ones that you think they're so good. You just hear, what happened? I'm sorry I had to say that, but but it's true. It's the same thing. It's the same thing with your health. It's so healthy. He's going to the gym. His muscles are this. His muscles are that. He dies even more than the one that's got. I hear stories where people in the days of when HIV was the number one killer. Two friends, one very healthy one. Oh, I'm good. The one that's dying, he's got diarrhea, he's got all this. They go to do the test. Guess who is the one that's infected? The other healthy one. So each of us, this is a sidebar from this. I just want to acknowledge, and I do this all the time, that as pharmacists, we can be of any use to the community if ourselves were not healthy. The next is cost effectiveness. Pharmacy in America now is going through a very, very tough time. Tough time in the sense that the gross profit that we make on prescriptions on drugs is not as high anymore. One of the reasons why that is a lot of products have gone generic. So we don't have that average prescription cost. It's no longer that high. You can only make just as much as you can on $1. You can't make $10 on $1. Over there, prices are not set in that manner. So what happened a few years ago when Walmart, if you know that big company, they brought out this flat fee stuff we used to make a ton of money before is now all $4. I would have thought in my life that people were not going to use those old medicines anymore, amitriptyline, chlorpheniramine. It turned out that when that was the only option that was made available because of the cost, actually, physicians and patients gravitated towards it. And that totally changed our mindset in most of us that, look, we should be focused and fixed on saving cost, helping people find lower cost generics, because this is it. One of the most important factor that made people not compliant with their medicine is what? So what's the point? If you write all the prescription for them and they take it only one time, or they buy the 10 milligrams, they get home, they start breaking it in half. So for us as pharmacists, we must be ready at all times to help people find cost-effective savings. Those people in wellness and in the healthcare business, they are very, very concerned about this, to help us all walk in a situation where we can save cost, but the medicines are still very, very effective. And most hospital pharmacies, I believe they have what we call formulary, meaning you just don't go out and buy any drug when there's a cheaper one that is already on the formulary. What we advocate, is that for me? What we advocate a lot is that pharmacists should be in that group or in that team that write formularies, that make selections of drugs, because there's no point where you don't have a pharmacist and they're making selection of drugs or products that really does not speak to the health condition that you'll be seeing a lot in the pharmacies. We talked about advocacy earlier. Some of the things we should be advocating for is we need to advocate for drug pricing. Victor is here. If his HMO is not paying us enough for the medicines that we discussed, he's here today. You can talk to him about that. But when we speak to people like him, he can tell us what are the factors and the levers that make them come into the pricing of the prices they give you. It's only when we advocate, we get people like him on such boards, and we get pharmacists like us too in that board, that we can, a whole lot of these decisions are made outside of this kind of public environment where we can sit down, we can banter, we can negotiate, and we have better reimbursements for everyone. Reimbursements are another thing. I give you this idea. There was 2013 when that was the last time that the government was totally paying for all prescriptions. I did 50,000 scripts and made about 700,000 in gross profit. The next year, I did 75,000 scripts, which is 25% more, but I barely made $300,000. So this cost cutting, it's everywhere around the world because we want to stretch that dollar, stretch that naira as much as we can to provide the most health benefit that we can provide for the community. Access to care. Pharmacists. One of the reasons why pharmacists are so important in universal healthcare is we are the closest to the patient. I'm sure here, every 2 miles, I think when I was practicing, you can't have a pharmacy 200 meters. So I would assume that every 200 meters, there is a pharmacy. Patients love to come to the pharmacy. There's no appointment. You want to go see a doctor, he gives you an appointment. Patients, because you live in the community as a pharmacist, you actually participate in other things more than just being in your shop. They see you in church. Your children play soccer with their children. So we, as pharmacists, we should take advantage of our profession and assure that this access we give to our patients, we can also use that to grow our business, grow our reputation in the community. The number one trusted profession in America today is the pharmacist. There's also pharmacy workforce development. Prof, I'm not meaning to pick on you today, but education is everything. We have to make sure that we have pharmacists that are adequately well-trained for the role that they're supposed to step into. Like I said earlier, pharmacy is you can't go to pharmacy school in America. You must first have a bachelor's degree. It doesn't matter whether it's in music, whether it is in biology, but you must have a 4-year degree. Then you have to write exams, do all sorts of interviews before you then go to another 4-year degree. That is when you get your PharmD degree. So during those years, there's at least a whole calendar year. It's half, I think, in year 4 and half in year 7, where the students don't go to school at all. The students are in experiential program. And that's why I was trying to talk to you about, look, we can't wait until the guy has finished B-Farm and then he's looking everywhere to do internship. He should have had that built into the curriculum such that he can go and he can intern, he can see a tableting machine. The student can go and see pharmaceutical care being practiced in a clinical pharmacy. The student can see advocacy. How do we make policies? How do we get things that we want on the policy in the House of Assembly? The student should be able to see all those before they graduate, such that by the time the student is graduating, the student had already determined that this is where I want to practice. We also have expansion of roles. I think the WACP is doing a good job at that, training pharmacists in different disciplines. We have pharmacists that are oncology pharmacists. We have pharmacists that are ambulatory care pharmacists. I would ask that each of us, if we can, as much as we can, try to expand our practice, expand our role, expand our education so that we can properly function. Technology integration. I was talking about technology earlier. Pretty soon, even now, from my desk, my office in the U.S., I can actually practice pharmacy here, telepharmacy. I don't have to be here. My mother and all our friends always call me and bring all these medicines. And then I have to sit over there on video and counsel and advise them. So that time is coming where in cutting cost, there will be no need to pay pharmacists to go sit somewhere where there's no road, but pharmacists will find themselves of great value when we understand the importance and the use of technology to be able to deliver care. And the last one, we need to be able to address individual needs. There's pharmacogenomics. As some of you may not know, you don't give every patient the same dose of methotrexate. You don't give every patient the same dose of even aspirin. People react differently to different kinds of medicine. And we need to prioritize patient engagement. In our practice over there, you actually involve the patient. Once the patient begin to feel that they're getting better, they're very likely going to be compliant with all the advice you give them, with all their medicines as well. So in conclusion, there are a lot of roles that are being shared in the healthcare industry. Some of them are falling in the laps of pharmacists. It is only those of us that are prepared by way of education, by way of advocacy, by way of involvement, that will be able to participate, okay, and be able to practice at the top of our license in a situation like Nigeria where we're heading into universal health care for all. And I want to thank you for your time. Thank you very much.
I want to believe we can do more for our keynote speaker. Excellent presentation, excellent delivery. Of course, what else do you expect? Thank you very much, sir. At this juncture, it is important for us to recognize the presence. We want to just appreciate all our sponsors, in vitro, in vivo, and ex vivo. So please, let's give it to them. All our exhibitors, a round of applause. Thank you so much. We appreciate everyone. This event is also a dual one. Apart from the lectures, we also want to appreciate and award some very hardworking colleagues who have really made their mark in pharmacy practice in their own specialties. We shall be welcoming the chairman of PSN to the podium to anchor this session. If you don't clap well, I'm not sure you'll receive lunch.
We also like to let the audience know that this event is being streamed online, live, on the Pharma Screen TV on YouTube. So you can share the link with your friends that want to watch online. Thank you very much.
So once again, good afternoon, distinguished colleagues. This is one of the highlights of the scientific week. You know, we give awards of excellence even to deserving colleagues. You know, this award started during the time of about 8 years ago with the only woman who became the chairman of this association, and she's still the only woman, pharmacist Bolanle Adeniran. So that was about 8 years ago. So there have been different recipients of this award, and like I said, it's award of excellence. So, you know, it is in the different categories of our practice. There is the hospital, there is the community, there is the academia, and the industrial. So let me start with the community. Unfortunately, for us, we have our brand new, the vice chairman of the Association of Community Pharmacists, the national vice chairman of the Association of Community Pharmacists in Nigeria. So, Pharmacist Oguntoye, will help us to give the awards to deserving community, community pharmacist practitioner. So join me in inviting pharmacist Oguntoye, the vice chairman of Association of Community Pharmacists of Nigeria. So I know that all of us have our program, the bronchial with you. Just open to page 30. So as to save time, we'll call the 3 awardees, and the MC will quickly do a short, citation of these recipients, and we'll be done with that. Thank you. So the 3 awardees, the 2 awardees in that category are pharmacist Ajiboye Razak Adebayo and pharmacist Abiodun Adediran. Please come out to. So.
Okay. Pharmacist Ajiboye Razak Adebayo. Ajiboye Razak Adebayo, a graduate of pharmacy from the prestigious Faculty of Pharmacy, Obafemi Awolowo University, OAU, Ile-Ife, 1990 class. After his internship and youth service, he worked briefly with Lagos State Health Management Board at the Island Maternity Hospital, Lagos, worked with several pharmaceutical companies as a medical representative, amongst which are Sweet Nigeria Chemical Company, Skadila Nigeria Limited, Nigerian German Chemical Company. He eventually settled down into community pharmacy as the MD CEO of Beke Nigerian Limited Pharmacy. He has been in community practice for over 24 years. A round of applause for pharmacist Ajiboye Razak Adebayo. We have pharmacist Abiodun Adeniran, born in the month of February in Oyo Town, Oyo State. He had his elementary education and post-primary, post-secondary in Oyo State. He is an alumni of Ladigbolu Grammar School and Olivet Baptist High School, Oyo Town, Oyo State. He attended the Faculty of Pharmacy, University of Ibadan, graduated with BPharm in the year 1992. He has worked in industry like Interpharm, Fontana Ventures, Ricket Benkitia, Gemini Pharmaceuticals in various capacity, and has traveled in the course of his service. His experience in promoting the use of radiological consumable is also top-notch. He's currently the MD CEO of Simba Medics Nigeria Limited, a community pharmacy retail outlet in Ikorodu Town, Lagos State. A round of applause for pharmacist Abiodun Adeniran.
Well, on behalf of Pharmaceutical Society of Nigeria, Lagos State Branch, we are presenting this award to you for making the community pharmacists proud in this category. Pharmacist Abiodun Adeniran. Thank you for making us proud. Congratulations, sir.
Thank you very much. Maybe pharmacist Bayo Adiboye is in, because I saw him just now. So let's go quickly to the hospital because we want to save time. Hospital category to, fortunately for us, we have one person who retired from the hospital but is not tired. So pharmacist Tanko Ayuba will come and help us in giving out the awards for the hospital practice. There are 3 in that category. One of them, she's unavoidably absent, but somebody will collect the award on her behalf. But the others are pharmacist Oyinkansola Mojisola Ejo. She's from Chevron Hospital. She's the head of the pharmacy department in Chevron Hospital throughout Nigeria. A round of applause for her.
Pharmacist Oyinkan Ikeja is a seasoned pharmacist professional. She is the manager, pharmacy and medical information management service at Chevron Nigeria Limited. Her career in her current organization has seen her growing through the ranks, through leading her local team, moving up to the helm of affairs in her current position. Oyinkan has led the pharmacy team in multiple initiatives that includes improved patient outcomes and the overall quality of life for the patients. She has also led the pharmacy team to achieve the COHOSA accreditation as part of the global recognition for quality service in the hospital of over 12,000 staff members. She has recently completed her doctorate in business administration from the European Institute of Management and Technology, Switzerland. With a proven track record, she brings a wealth of experience to her role and other multiple endeavors. A round of applause for pharmacist Oyinkan Mojisola.
Good afternoon, my colleagues. Somebody saw me early in the morning when I arrived, and he said, "You came all the way from Kaduna to attend this event." I said, "Yes, this is Lagos." and what lies ahead of me, I cannot joke with Lagos. I've been a hospital pharmacist all my life, so it is appropriate that I should be asked to give the award for hospital pharmacists. So, pharmacist Oyinkan Mojisola Ejo, all the Sola, don't carry. The Lagos State Pharmaceutical Society of Nigeria is presenting this award to you, which is called Pharmacy Practice Excellence Award, at the 2024 Scientific Week at Providence Hotel, Oba Akinjobi Way, Ikeja, Lagos. Congratulations.
The second awardee in this category is the head of Department of Pharmacy, Lut. Please join me in welcoming pharmacist Wahid Adeoye to receive his award.
Pharmacist Dr. Adeboye Wahid obtained his Bachelor of Pharmacy degree from the prestigious Obafemi Awolowo University, Ile-Ife, and a Doctor of Pharmacy degree from University of Benin. He is Director, Head of Pharmacy Hospital Services, Lagos University Teaching Hospital. He has a postgraduate diploma in Computer Science and MSc in Pharmaceutical Chemistry, both from the University of Lagos, Akoka, Lagos. He is also a Fellow of the West African Postgraduate College of Pharmacists. He has served pharmacy profession at different levels in different capacity. He's a devout Muslim and his family is blessed with 3 children and 2 grandchildren. A round of applause for pharmacist Wahid Adeoye, MAW.
Pharmacist Abdul Wahid Adeoye, Merit Award winner. The Pharmaceutical Society of Nigeria Lagos State Branch is presenting this Pharmacy Practice Excellence Award to you at the 2024 Scientific Week taking place in Lagos today for your excellent service to the profession and to the branch. Thank you.
So before we go on in this award, let me recognize our brothers from other states, even, of the Federation. The Secretary of the Pharmaceutical Society of Nigeria, your state, is around. Pharmacist Akala. Please help us appreciate Pharmacist Akala. The immediate past chairman of PSN in Oyo State is also around. And you know him, he's always on the line. Pharmacist Ajibade. Please help us appreciate Pharmacist Ajibade. If you are on the social media, you will always see him with pharma plan and all that. So thank you for coming. As you are just giving the award, the chairman of Ogun State, PSN, is also around, pharmacist Wale Adenugba. Please, let's appreciate pharmacist Wale Adenugba. We thank you all for coming. Thank you very, very much. So let's quickly go on to the industrial award now. To help us give out the industrial award, the representative of the president, Gafar Madein, will help us give out. So let's join us to welcome pharmacist Madein, this secretary, National Secretary PSN. The awardees are pharmacist Ephraim Eza, manager of SKG Pharma. Guys, okay, you are welcome, sir.
Pharmacist Ephraim Eze is currently the general manager of SKG Pharma Limited, and he's an alumni of the University of Benin Pharmacy School. He has over 24 years experience in sales and customer relationship management. He started his career as a medical rep in SKG Pharma Limited and later moved to Juhel Limited as an area sales manager. He later returned to SKG Pharma Limited as an area sales manager and rose to the position of national sales manager. He now heads the national sales team in SKG Limited as the general manager. A round of applause for pharmacist Ephraim Eze.
Pharmacist Ephraim O. Eze, the Medical Society of Nigeria Lagos State Branch, is proud to present to you today Pharmacy Practice Excellence Award, Industrial Pharmacy, at their 2024 Scientific Week. Congratulations.
So the second awardee is pharmacist Ibitayo Salami. She was actually the marketing research manager of Glasso, but now she's the country manager of Ipsos, the second largest marketing research company all over the world. So join me in welcoming pharmacist Ibitayo Salami.
Pharmacist Ibitayo Salami has over 20 years of experience spanning sales, marketing, and strategy. Her experience is grounded in market research and insight, but has made important contribution in general marketing as well. Her 11 years career in GlaxoSmithKline Nigeria has largely spent as a medical representative, looking after the market research function and brand management. She joined Ipsos in August 2016, bringing her wealth of experience ranging from consumer and cultural insights development to influencing business to move from strategy to action. She has a Bachelor of Pharmacy degree from the great Obafemi Awolowo University and MBA from Ambrose Ali University. She's currently the country manager for Ipsos in Nigeria. A round of applause for pharmacist Ibitayo Salami.
Pharmacist Ibitayo Salami, the Medical Society of Nigeria Lagos State Branch, is proud to present to you today Pharmacy Practice Excellence Award, Industrial Pharmacy Sector, at their 2024 Scientific Week. Congratulations.
Thank you very much.
So the last but not the least awardee in that category is my very good friend, the immediate past chairman of CPC National, pharmacist Victor Adekonye, MAW.
Pharmacist Victor Adekonye Olumuyiwa MAW is a seasoned sales and marketing professional and business manager with added experience in key account management, in the current trade marketing manager at the Worldwide Commercial Ventures Limited. He joined Worldwide Commercial Ventures Limited for the first time between 2005 and 2007 and moved to Crystal Foods and Drug Limited between 2007 and 2011. He came back to Worldwide Commercial Venture Limited from 2011 till date. He was the chairman of the Anti-Drug Misuse and Abuse Committee of PANS. And he's also the president and investor of Fellows for PSN February 2022, member of Development and Special Projects Committee of the PSN, chairman of Conference Planning Committee for the 95th Annual Conference of the PSN in Jos Plateau State. A round of applause for Pharmacist Victor Adek, MAW.
Pharmacist Victor Adekaye, Merit Award winner, Lagos State. Pharmaceutical Society of Nigeria, Lagos State branch, is proud to present to you today Pharmacy Practice Excellence Award, Industrial Pharmacy category, at their 2024 Scientific Week. Congratulations.
The National Secretary have a few information for us. So before we continue with the awards, the National Secretary will give us updates on the national conference in Uyo in November.
Thank you, Chairman, for the opportunity to hold the mic the second time. The award to the last awardee, Pharmacist Victor Adekaye, actually brought that thing back to my memory. You know, I was supposed to have given you this information earlier. The Central Planning Committee of the Annual National Conference of PSN is proud to inform you that another conference of PSN National is around the corner. In fact, it's just about 63, 64 days away from now. As you might have been receiving the countdown, you know, on the various national WhatsApp groups. The conference is promising to be a very exciting one, and it's going to hold between November 4 to November 9th of this year at Uyo, Akwa Ibom State. We have put everything in place to ensure that you have a memorable, enjoyable experience of the coming conference. If you attended the Gombe conference, you will know that the National Conference of PSN, you know, that we have raised the bar, you know, and we will continue to raise the bar. The Uyo conference is going to be better than Gombe. It's going to become better and better. And we have put everything in place to ensure that nature, which we know we cannot control, but we have put everything in place to ensure that we mitigate every negative impact that nature can have on that conference. So be rest assured that it's going to be a wonderful conference for you to enjoy. And the theme of the conference, transforming pharmaceutical innovation to facilitate equitable healthcare in an emerging economy, is very apt. And the keynote speaker for that conference is no other person than the Honorable Minister of Health and Social Welfare, Professor Ali Pate. That is for you to see that it's going to have strong government presence. So it is an opportunity for you to be part of this conference. And Uyo, as we are well aware, is very accessible from every part of the country. There's an Ibom airline that flies from to several states, and then also there is Peace Airline, Air Peace. They also fly Akwa Ibom. So they go there every day. So therefore, commuting to Uyo will not be a problem. From Lagos, especially from Lagos. So they have flights every day. So anytime you want to come and you want to leave. Then the chairman of the event is the Obi of Onitsha. And we have many other dignitaries that you will love to meet at that conference. The registration has started in earnest, and I want to confirm currently, we have about 2,000 delegates that have registered for this conference. 64 days to the conference, but we already have 2,200 registered for the conference. So if you have not registered, please go ahead and register. The links are there online, for you to register. And the registration is easy. We note that a couple of weeks ago, there were challenges in registration, but I think that has improved tremendously. It was due to internet glitch at that time, but it's easy now. You can easily do registration. And if you have any difficulty, the helpline that you will contact is there on the website, and they are always ready to attend to your issues. So thank you very much as we await to welcome you to Uyo for Ibom 2024. Thank you.
Thank you very much. A round of applause for our National Secretary. At Uyo, we'll be electing brand new president, brand new this and brand new that. So thank you very much. When we were giving the community sector award, one of the awardees maybe went to ease himself. So let me crave the indulgence of the vice chairman of ACPN National to still come up to give the award to pharmacist Bayo Ajiboye.
Since the citation has been read, pharmacist Bayo Ajiboye, on behalf of Pharmaceutical Society of Nigeria, Lagos State Branch, this award of excellence is being given to you as one of us in ACPN. So we are proud of you, and we say congratulations. Thank you.
So we are now going to the academia, the people that produce all of us. And when the keynote address was given, was troubling Professor Adebayo. He did not know that there are other professors in the house. So he shouldn't have limited the trouble to Professor Adebayo. Because our awardee for the academia, and only one awardee in that sector, is Professor Pharmacist Gloria Abiodun Ayola, who is actually the Dean of the Faculty of Pharmacy, University of Lagos. To give out this award is my sister, Professor herself, Adetutu Afolabi. Come and give this award out on behalf of PSN.
Professor Gloria Abiodun Ayola is a distinguished expert in natural product drug discovery pharmaceutical analysis, and nanomedicine research. She earned her undergraduate degree in pharmacy from the prestigious UCL School of Pharmacy in 1990. In 1998, she completed her PhD in medicinal chemistry at University of Bath, where she synthesized several analogs of cyclic adenosine diphosphate ribose, a secondary messenger in cell signaling. Professor Ayola has held leadership roles at the University of Lagos, including 7 4-term as acting head of the Department of Pharmaceutical Chemistry. She has also contributed significantly to the university governance, serving on numerous boards and committees, such as the Board of Postgraduate School, the Student Disciplinary Board, and the Board of Trustee of the Ladipo Mobalaji Abisogun Afodu Annual Lecture in Pharmacy. Additionally, she chaired the Faculty of Pharmacy Research Conference Planning Committee and the Faculty Curriculum Review Committee. Beyond the university, she served on the board of Media Hall Foundation, a foundation dedicated to providing underprivileged children with quality and well-rounded education for 4 years. Currently, she serves as the Dean of the Faculty of Pharmacy and the University of Lagos and is an external examiner at the Olabisi Onabanjo University. She has mentored 8 PhD students and over 100 MSc and undergraduate research projects. In addition to her academic and research endeavors, Professor Ayola is passionate about coaching women and young adults to reach their full potential. She also enjoys writing and lifelong learning. A round of applause for Professor Pharmacist Gloria Abiodun Ayola.
On behalf of the Pharmaceutical Society of Nigeria, Lagos State Branch, we present this award to you, the Pharmacy Practice Excellence Award Academia, to Professor Pharmacist Gloria Abiodun Ayola, the Dean, Faculty of Pharmacy, University of Lagos.
Professor Ayola actually is PSN compliant. Because when I became the chairman, I was at the faculty. The faculty even, they requested that practicing pharmacists, just like what the keynote address speaker was speaking about, that practicing pharmacists should come and be part of their curriculum generation. And we were, my sister, the APIN chairman, and the ACPN chairman, myself, and other pharmacists, we were at the faculty, and we were able to help them with generating some of the things, that we thought should be in the curriculum, just as keynote address speaker have said. And even one of the departments now, even has called out again that we should come to be part of, to look at their curriculum and, give our inputs to their curriculum generation. So, very much. So now we want to go to the grand awards. We really appreciate our keynote address speaker because he came all the way from the Americas, even though he's Lagos PSN member. So we do not take this one for granted. And to give out this award to our keynote address speaker is pharmacist Anthony Bola Oyawole, FPSN. He was mentioned as one of the people that are his senior colleagues and he knows very well. So, and pharmacist ABO was actually the chairman, past chairman to be here today. It was quite early. So please join me in welcoming pharmacist Anthony Oyawole as he gives out the award to our keynote address speaker.
Well, thank you, the chairman. Dr. Tometi, am I pronouncing it right? That's the American slang. On behalf of the Pharmaceutical Society of Nigeria, Lagos State Branch, this is an appreciation award being presented to you, not just for coming, but delivering a very powerful, insightful, and thoughtful, thought-provoking keynote address on the theme of this year's conference. I think it was delivered in a practical way that everybody could relate to. And that is a testament to the dexterity and the versatility of pharmacists wherever they find themselves in the world. So he delivered it in a professorial way. So we can call you professor also. So to our dear own pharmacist, Adekunle Tometi, FAMD, fellow Pharmaceutical Society of Nigeria, fellow Nigeria Association of NAPSA, and the fellow of Nigeria Academy of Pharmacy, as the keynote address speaker on the occasion of this 2024 Scientific Week, holding in this prestigious Providence Hotel. So, my dear brother and colleague, or is he partner in crime now? I present this to you, Aluta. I present this to you for a wonderful delivery of the keynote address of today. And we wish you well as you go back to the Americas. And when the need arises, we will call you back again. Congratulations.
So, let's appreciate our keynote address speaker. So he has invited us to the Americas for his inauguration next year. So as many as we want to go, so just contact him. Yes, maybe we give us free tickets. Let us allow them to take the pictures before we call out the last awardee for today, the chairman of the occasion. No, we will call you. Don't worry. Let them enjoy their picture. Immediately after the chairman of the occasion award, all the awardees should come out to take picture. The ones you are doing, that one is, I will tell NAFDAC to give you fake license because it is not certified. So permit me to welcome a past president of the Pharmaceutical Society of Nigeria, the remodeler, and the practitioner, whatever, the jurisprudent himself. He will help us in giving out the award to the chairman of the occasion. So please join me in welcoming Pharmacist Olumide Akintayo as he hands out the award.
Distinguished colleagues, presented this to Victor excites me a great deal. For those of you who probably don't know Victor very well, you know, Victor is actually one of the biggest gifts to our profession in very recent times, in contemporary times. Very skilled, pharma skills, and of course, non-pharma. He's particularly very outstanding when it comes to his non-pharma skills. And he's probably one of the very few pharmacists who continues to make us very proud in the value chain of social health insurance in Nigeria. And so, on behalf of the Pharmaceutical Society of Nigeria, Lagos State Branch, it is my great honor and privilege to present this most deserving award to Victor. Afolabi, who is also, Victor is also one of the anchors of the centenary celebrations of the Pharmaceutical Society of Nigeria. We're working on that project, and he's one of the people I'm relying on to give the Pharmaceutical Society a very befitting centenary celebration in 2027. So, distinguished colleagues, I present this award on your behalf to one of our leading lights and one of the most promising sons of the Pharmaceutical Society of Nigeria. Where's Madam? Please let Madam join us here. You know, if you're not very careful, in these matters bordering on left ventricles, you need to be very careful, because this is actually the driving force, the one who propels Victor. So I think you should be here.
Congratulations. When you have your left ventricle constantly working, you are free from left ventricular atrophy.
So we are rounding, we are actually on time. By the grace of God, we should eat our lunch in the next 20-30 minutes. But there are still some events that we still need to attend to. We need to cut our Before we cut our cake, please let all the awardees come out, and all those people who have all my living ancestors, join us as we please. Indulgence, and all our people from Oyo State and my chairman, please join us as we take a group photograph with the awardees. Please.
If you have your right ventricle with you, please let him come. If you have your left ventricle, let her come.
Please, all the awardees come out. Please come and take picture with my Irumoles, the living ancestor. So,
today we are excited to.
Please, all the awardees, please come. Maybe let the awardees first take their own, then my living ancestors will join them. Keynote address speaker, come to the center with the chairman. No, come. Keynote. Oh yeah.
One drinks to one more, one car to one, catch a good job, banana. Alhamdulillah, call me for that. Yeah. I'm a girl, I don't walk in those, but you power sporty, but you see those shorty. Put him one, I'm on two, when you call a mura, kiriwa, they give him baby. Twerk your body, twerk your body, twerk your body, twerk. Hollywood, down, twerk your body, twerk. Nagasaki, plenty among me miscalculate. Don't make me over the pay. Don't make me the misbehave. With the way them twerk. If you don't make a man go, taking a pepe. Eka me oh Jesus, baby feeling the boy like Oleku. Awesome the way, oh yeah, see.
So thank you very much. Let's move to the cutting of our beautiful cake, the scientific week cake. So as to accommodate as many as we can, maybe we cut the cake in, we are pharmacists, in batches. So we cut the cake in batches so that we'll be able to accommodate, because the last picture, I don't even know whether some of us will be able to appear in that picture. So what we'll do is that all my past chairmen and the chairman of BOT, let's first come out to cut the cake. Then we do it in batches. So maybe all our visitors will come and then awardees, then fellows, like that. Let's cut our cake. Because if we say people should, it will be 2 rounds. So please permit me in welcoming all the past chairmen of PSN Lagos and chairman of BOT to cut the cake.
Yeah, nice. Don't sleep, wake up. Collect your money, wake up. Collect your money.
We are waiting for the.
Wake up. Get go get the moolah. Wake up. Koniko kala. Don't walk, you don't try. You supposed to be jai. Same matter, person we don't mind. When I land softly on the sofa floor. So far so good, Koni Bajo. Let me see you. Oh, lo. Let me see you. Oh, lo. Bukao. Let me see you. There, Buka. Oh, lo. Let me see you. Oh, lo. Bukao. Let me see you. There, Buka. Oh, lo. Let me see you. Oh, lo. Bukao. Let me see you. There, Buka. Oh, lo. Let me see you. Oh, lo. Bukao. Let me see you. There, Buka. Go get the dollar. Wake up. Don't walk, don't try. Supposed to be hard. Kilo go chef. Let's see what I'm at. When I land so free on a sofa floor. So far so good. Koni Bajo. Let me see you. Oh, lo. Let me see you. Oh, lo. Bukao. Let me see you. There, Buka. Oh, lo. Let me see you. Oh, lo. Bukao.
Yes, sir. So all the awardees, please quickly come out. Okay, before the awardees, let the high table, the chairman and the keynote address speaker come. Oh yeah. No. Oh yeah. Where is Mrs. Chairman?
All right. For want of time and speed, we're going to just call PSN. Please, let's touch the knife so we can achieve universal health coverage. Okay, PSN. PSN. Thank you. The next set of the awardees. Please, you can leave your left ventricle aside and lift your right ventricle aside. Just come with your whole body. Awardees and the keynote speaker and the chairman of the occasion, chairman of PSN. Awardees. Let's this way. All right. Let's just stretch forth our hands. No. If you are far away, just touch the shoulder of the person next to you. Shoulder. Okay, fine. Okay. Good. Fantastic. Right. PSN. Thank you. Yes, chairman of technical groups and also
So I call your name when I ask me. That guy is my guy.
Let me go. Chairman of technical arms of PSN Lagos. Interest groups, arms. Our guest, PSN chairman, Oyo State, PSN chairman, Ogun State, Secretary, PSN, Oyo State. This way, don't you go what?
You be my G, my G. Yeah, I'm feeling good tonight.
Abs, where is Abs? Abs. Ogun State PSN chairman, Adewale Adenugba, FPSN, DPS. Okay. So, you want to cut the cake now? Chairman, you are supposed to be in the middle. Where is Abs? Abs is here. Are you Abs? I called Abs and you came. Please stretch forth your hand towards me. Okay. PSN. Bagam. Next. Chairman, you are permanently rock. You are not moving. DPSs. Deans of faculties of pharmacy. PCN director. Professor. VC. Oh, yeah. DPSs. PCN should be close to PSN. Yes, PSN, PCN, be close to PSN. Then you cannot be close to academia. Then you cannot be close to, okay. D pharmacy, Unilag. D pharmacy, Unilag.
I'm at the point in life, if you understand me or not, misunderstand me or not.
All right, so let's stretch out our hands towards the knife as much as we can. Okay. Then we just mention P. Are you ready? PSN. Bagam. Thank you for your presence. Next. Okay. If you, all the members of the planning committee available, please come and cut your cake. And fellows of, oh, please, yeah, fellows. Yeah, fellows of the society. Fellows of the society. Followed by planning committee. Pharmacy Week Planning Committee. Fellows of the society. 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 I didn't know we can break it. Hello, you are. Hello, Tosin. All right. Thank you very much. Another set of fellows. The second set. Second set of fellows. Second set of fellows. Please. Help me bring that Yoshinaike, please. Yola. Bring Baba. Please, can we give right of way for the photograph? President, sir. Can you sit down, sir? Hello, right of way for the photograph. Right of way. You have blocked the binoculars. Bye-bye. Okay, are we done? On your mark, set, go. Okay, all merit award winners. Apart from fellows, not fellows. Merit award winners without fellows. From your effect. Which one is this one? Merit award winners. Please, some of us should climb up. Yes. Please, climb up. Climb up, please. Climb up. Let's climb up. It will be better, man. Merit award winners, let's go up. It's better upstairs. It's sharper and better. Yes. It's sharper and better. Are we together? Hello, are you ready? Photographer, are you ready? I remember that I'm also one. This is the photography with NAFDAC number. Planning committee members. Yes, I'm through with you. You can go to your village. You can go back to your village. Remain where you are. Chairman. Tosin. Adeyemi. That man, very ubiquitous. Sit down here. Stay with your. I'm more big. PPC Pharmacy Planning Committee. If you are not here, you're on your own.
Skeleton blaster, aka Buster Bradtree, aka the rap guy. You all know what time it is, and right away I'm hanging out with the baddest, maddest DJ Jojo, the baddest DJ and the pilot of all good music. Keep on driving them fast, man. I'm on my seatbelt, nigga. Now drop it.
All right. If you are a DSA holder, this is if you are a GSM holder. If you are a friend of pharmacy or you are a pharmacist, you want to take picture, please come. Please come. Yeah, come, everybody come. If you DSA, SAD, come out. All awards. If you have any award in your hand, if it's pharmacy, come out. Any award. Excellence award, picnic award, the best award. Oh yeah, grab out, yeah.
Please, let's sit down. We soon go for lunch. But before we go for lunch, please, let's sit down. We will network during and after lunch. Please, let's sit down. Please, in any moment from now, please, the PCN director, the Dilazo in Lagos. Please, let's sit down, please. We will network after this time. Somebody lost this. Please look up. Somebody lost this.
Please, can we be seated?
Please, let's be seated. Please.
Please, our director of PCN Lagos Zone Office wants to speak to us. 1 minute of your time. 1 minute of your time, please.
Just an announcement. For those of you that have been finding it difficult to come to our office for your licenses, we brought your licenses for you here. You can go outside and pick your own license. Secondly, the Form K, we have told some people that were at the meeting before, the poison book is now decentralized and specialty based. We have poison book for community pharmacies separate from that of hospital pharmacy, from that of importers and manufacturers, and they are all outside. You can get yours before you go. Most especially the licenses. You have opportunity now without coming from Ikorodu to Yaba. You can pick yours now before you go. Thank you.
Thank you very much, our director. Please, for reiteration, please pick up your licenses. Be reminded of our tomorrow's event at the Secretariat, Como Medical Outreach. Please be there. 9 a.m. The first 20 to come have special gifts. And all our days of today, please, it's mandatory you come and serve your society. Thank you very much. The Como means Council of Merit Award Winners, COMAW. Council of Merit Award Winners. And our daddy here is the chairman of that council. New members, is compulsory you come.
Please,
9 a.m. at the Secretariat.
Please, can we be seated? We'll be listening to a presentation now from one of our sponsors, Gates Pharma Nigeria Limited. Please, let's be seated as we listen to the presentation. Are they ready? Please, men of honor, can we be seated, please? Should I start calling names? Please, if you are standing, you are wrong. Captains of industries, I'm seeing you. I will call names now. Please, could we be seated? We want to listen to Get Pharma Limited. Thank you very much.
Good afternoon, everyone. My name is Aderonke Yusuf. I'm a pharmacist and I work with Guest Pharma as a product manager. So, Guest Pharma as a company, in the past we've done different presentations with the organization, ranging from our cardiometabolic portfolio down to our anti-diabetes portfolio, our gastroenterology, anti-infective urology, anti-allergy, and some of our non-steroidal anti-inflammatory drugs. So today I'm here to do a quick reminder and a rundown of our general portfolio. Guest Pharma is among the group of companies, and we have our manufacturing plants pre-qualified by WHO, and we have quality medicines, and we've been in the country for over a decade, marketing quality and effective medicines for both adults and children. We have our anti-malaria ranges, which has the Atiget EZ, our 8480, which is our anti-malaria, available. And we also have our cardiometabolic ranges from the amlodipine, the Amlo brand. We have it in 2 SKUs at 5 milligram and 10 milligrams. We have our Candesatan, which is our Advant at 8 milligram and 16 milligram. Then we have our Getzominster, which is a combination of omeprazole and sodium bicarbonate. It is a dispersible, and one of the special things about this brand is the fact that its onset of action is very short, and in 1 minute your patient gets relief from heartburn. We also have our other ranges for diabetes, such as the SGLT inhibitors. We have the empagliflozin and empagliflozin plus metformin. Our Empiget 10 milligram, Empiget 25 milligram, and Empiget M at 12.5 milligram and 1,000 milligram. We also have our newest launch, which is Vacutro. Vacutro came into Nigeria early this year, and we are the first to come to market after the Innovator brand. This is the only molecule that belongs to the angiotensin receptor neprilysin inhibitor. It's the first line for heart failure with reduced ejection fraction. And we have it in 3 SKUs at 50 milligram, 100 milligram, and 200 milligram. The maximum daily dose for Vacutro is 200 milligram in 2 divided doses. So depending on blood pressure and EGFR of patients, the patients are started on the lowest dose and titrated upwards and checked every 2 to 4 weeks. We also have our Salboget inhaler. This is our second new product for the year. This product was also launched this year. This is our brand of salbutamol. It's readily available, and each canister contains 200 doses. We have our rabiprazole Prompto at 20 milligram. Then we also have products for allergies and asthma, such as the fexofenadine, Fexet at 120 milligram and 180 milligram for allergic rhinitis and for urticaria. We have Montelukast. We have both for children and for adults. in the management of asthma. And then we have Fortide, which is a combination of a reliever and also used as a controller. The unique thing about Fortide is the fact that when it comes to the management of asthma, you usually want your patients to have their asthma well controlled, so they are able to take their controller every day, while they take their reliever only when they have attacks. Saltrol is our brand of salmeterol fluticasone. We have it at 25,125 and 25,250, also available. We also have our range of antibiotics. We have the moxifloxacin, Moxiget infusion, and Moxiget tablets. We have azithromycin suspension and azithromycin tablets. Then we have clarithromycin at 250 milligram and 500 milligram. We also have ranges for diabetes still, the DPP-4I inhibitors. We have standalone sitagliptin at Trivia, 100 milligram and 50 milligram, and a combination with metformin at 5,500 and 51,000. Then we have our vildagliptin and vildagliptin metformin, which is our Vilget M brand. We also have Getril, glimepiride. Then we have Olifit. Olifit is our Olistat at 120 milligram. The good thing about our Olifit is the fact that the formulation is pellet technology. What that implies is that it makes the side effects less prominent compared to other molecules that are Olistats. We have our febuxostat for gouty arthritis at 40 milligram and 80 milligram. Then we have our other medications for hypertension, candesatan and candesatan combination hydrochlorothiazide. We have Tasmi at 40 and 80 milligram and Amlo at 10 milligram and 5 milligram. We also have our solifenacin at 5 milligram and 10 milligram. Thank you. So with all of this wide variety of portfolio, we are here to partner with you for the next decade in order to achieve the universal health coverage for Nigeria. Thank you very much for your time. If you have questions or any comments, please let's take the next 5 minutes to do that.
When pharmacists present to pharmacists, there are a few questions. When guests present, there are no questions. Why? Because you delivered it excellently. True or false? A round of applause for her.
Thank you very much.
Thank you very much, guys. We appreciate you. I want to believe that it is not because our glucose level is low. That's why we are asking no questions. Is that so? The solution has come. Let there be food. I declare now that food be available in this hall. Yes, please follow the direction of the social secretary. Is there? You can see him raising up his hand. Please, as he directs you, follow. Because if you obey, you will eat. You eat the good of the land. So, 5 minutes. Okay, good. Please invite all fellows to please just relax. Even me that I'm talking, I'm beginning to see vision. I'm seeing that somebody's on this place. People on this side are wearing blue. People on this side are wearing blue. People on this side are wearing yellow. Am I correct? Am I correct? I'm not seeing well. That must be hunger. That must be hunger. Please, the exhibitors, let's visit them. Let's patronize them, especially community pharmacists and hospital pharmacists. Let's support them. So next year, one company can take the whole bill. So it's nice having us together. It's been fantastic. It's been awesome. Tomorrow, let's do it again. Service to the community in which we are residents at the secretariat. We are going to have the Como organized medical outreach. It's always awesome. I had to change my flight. from Friday to Saturday. I'm actually traveling tomorrow. I was supposed to travel tomorrow, but I changed it from Friday to Saturday morning. I'll be leaving very early on Saturday morning to Shagamu. So please ensure that you join me tomorrow. Let us make it fantastic a day. God bless you all. So please, can you give us danceable music?
Luxury or nothing. Money is talking. Money is talking. Blessings on blessings. How much is money? Balling. Premium or nothing. Now you know. Now you know.
Modernization, she gave from any pressure, street orientation. Modernization, from any pressure.
Oh my niggas, sharp, bro. Cover face like Beja. Get feel like but we know they come. Tip boys them tap. Pass all this shit, rababa. Oh my ego, rababa. Feeling good, banana. Music don't need permission to enter a space. Anyway, anyhow, you know, say you go see me. Music don't need permission to enter a space. Yeah. Anyway, anyhow, you know, say you go see me.
Black for life, black forever. It doesn't matter what God says, she because you get me with the block. Let's see. All I know is that when I take up, I hit and go. All I know is that when I been shoot, I hit their home. All I know is that when I take up, I hit and go. All they know is that when I been shoot, I hit their home. So, why they wanna cross? Put them in the cross.
Hello. Please, if you bought a PSA test kit from New Heights yesterday, go and see them now and collect an extra buffer. I think they are somewhere here. Just at the back. Yes, they are at the back. Go there and collect an extra buffer. Thank you. If you didn't buy yesterday, you can buy today and collect the extra buffer.
Shake and yash for my money. Odumodu fala follow the cipher country. I go fill my gas. Come, higher cash. Fun, while I the fun. Sean, my ups on the lost. Cause all I know is that when I be cock, I hit and go. All I know is that when I be shoot, I hit the hole. All I know is that when I be cock, I hit and go. All they know is that when I be shoot, I hit the hole. So I don't wanna cause. Put him in the cross. Call me their own. Blood, really call their own. So I don't wanna bring blood down to my front. No, I don't wanna drink more blood on the dance floor.
I do always expect these things. Normally. You did try us, you did try me. Normally. We came here to party, nah, but you came here to find me. You came here to find me. The thing within my mind.
I go fill my glass, cup, higher cash, phone, while I need phone. Show my ups on the lost, cause.
Run for your life, they gon' come for your life. For my one true advice, bring a gun to the fight. There you go. Kiss the kids and the wife over here, shit get real. If for real, could be bad when they go. I ain't about to guard like a motherfucker who. You bring it to my door, I'ma send you to the boat. The thing about war, you will never know. Close it, the windows closed, they be in the back door. And I don't trust nothing but this God-given flow. You violate the alarm when you pass on dope. They crash out for me, cause I ride for my folks. Take a chance if you want, we gon' dance.
All I know is that when I make up, I use that good. All I know is that when I make shoes, I use their own. All I know is that when I make up, I use that good.
Yeah, touchdown, Nyanako. Young way, man, the boy looking like $1 million. I'm never seen like a billion van. So what's the plan? Who to God, yeah? The same way, got to love, boy. Oh, if I can get out. Do I look like I give a fuck? Do I look like I give a fuck? Do I look like I give a fuck? I don't give a shot, dog. I told you. Do I look like I give a fuck? Do I look like I give a fuck? Do I look like I give a fuck? I don't give a shot, dog. I told you. Do I look like I give a fuck? Top man, if I name it, no go put your.
Please, let's follow the instruction of the social secretary, please. Let's follow the instruction of the social secretary. Let's make it seamless. Let's make it free of crowd and rowdiness. Thank you all.
Theme, 40 years of advocacy, fostering partnership and innovation
So
to
please,
unlock
all
the
our
pharma manufacturing
exhibitors
value
are
chain
in the hall and
Nigeria,
outside.
Central and West Africa.
Purchase at
Keynote address
discounted
speaker,
rates.
Professor Pat
Green light, all of them, please.
Chief Executive
Ensure that they don't
Officer,
take
African
any
Pharmaceutical
item back
Technology
home.
Foundation,
They should not
Kigali,
take
Rwanda,
any
and
item
senior
back
advisor
home.
to the President,
All must be
African
dispensed
Development
with
Bank,
cash.
Abidjan, Cote d'Ivoire. Special guest of honor, Dr. Tsuji Alausa, Honorable Minister of State for Health and Social Welfare, Federal Republic of Nigeria. Chief host, His Excellency, Mr. Babajide Sanwo-Olu, Governor, Lagos State. Host, Oluwatosin Jolayemi Esquire. Chairman, PMG Man. CEO, Managing Director, Daily Need Industries Limited. Date 4th to 5th September 2024. Venue, the Balmoral Convention Center, Sheraton Hotel, Ikeja, GRA, Lagos, Nigeria. Time 10 a.m. daily. This hybrid event will be streamed live on PharmaStream TV YouTube channel, inclusive of all PMG Man platforms. Subscribe to these channels for live notifications. Announcer, Pharmacist Patrick Aja, Chairman, MPME 2024, MD CEO, May and Baker Nigeria PLC. Signed, Pharmacist Frank Mwaneme, Executive Secretary, PMG Man.
Hi, my name is Chizaram, a representative for Emzo Pharmaceutical Industries. So here today we have a lot of product displayed for you. I will be waiting for your patronage. So I'm going to be showing you some of our products we have and some of the promos that are attached to them. So right here is Emzo's brand of Cotrimoxazole. It's called Cotrivag, 200 milligrams. And there's this particular product, There's this product we are really running a promo on. Emzo's brand of cefuroxime. It is called Kezitil 500 milligram. This product, we are putting it on a promo. Normally the price is around 3,000 naira, but today we are selling it at the price of 2,800. Now, if you're able to get from 5 packs and above, you are going to be getting a word cloth, and then some other promotional items that are attached. We also have our brand of DHP, Emzo's brand of DHP here, the Hydra Temestin Pepper Cream. Normally it is sold for 1,300, but today we are giving it at a price of 1,100. And then if you're able to get a pack of it contains, a box of it contains 10 packs. If you're getting up to a box, you also have a gift attached. You get a wall cloth, you get other promotional items attached. So I'll be expecting you. This is our brand of Zolax 400 milligram chewable. It is coated in chocolate. It is very, very delicious. We are bringing in this product. I know a lot of you must have seen it, but it is also on promo. We also have other products. Emzo's brand of Cefixime. It is called Emzifix 400 milligram. It is also on promo. You would like to know that. So we'll be expecting to see you on this stand. Thank you, and thank you very much.
My name is Bumi Sarumi. I'm here at the PSN Lagos Pharmacy Week. I'm representative of Get Pharma. I'm at the Get Pharma stand. So we have our brand of product ranges here with me. One of them is Salboget, our brand of salbutamol. So this is actually on a promo. If you buy 10 packs of this, you get 1 pack free. We also have our brand of azithromycin suspension. It's also on a promo. If you buy 10 packs of this, you get 1 pack free. And then we have our brand of Artemether lumefantrine, Ateget EZ. It's also on a promo. If you buy 10 packs of this, you get 2 packs free. And then we have our brand of Get Zone Easter as well. This is not actually on a promo, but it's our very unique formulation, omeprazole and sodium bicarbonate. It comes in 40 milligram and 20 milligram, as you can see here. So all these products are available for you. Thank you.
Good afternoon, distinguished pharmacists. My name is Joy Jobanaria. I represent New Heights Pharmaceutical. So we have 3 portfolio of our products. The first on the list is the health check ranges. So here we have the pregnancy test kit that detects pregnancy as early as 4 days after conception. It is a product of choice when you want to detect HCG. Then we also have the PSA test kit that detects prostate-specific antigen. We also have the Triple H viral cassette. It's the first cassette here in Nigeria that detects HIV, hepatitis B and C at the same time with one sample, with a single blood sample, without cross interaction. And then we also have the H. pylori cassette. We have also our BG check machine, a blood glucose meter, and the strips are readily available here in Nigeria, distributed nationwide. Then let me move on to the Omron products. So for the Omron ranges, we have the M1 Basic. We have the M1 Basic, which is the most affordable product in our ranges, for the Omron ranges. So anybody, it is affordable, it is pocket friendly. So no matter how the situation or economic situation in Nigeria, you can afford M1 Basic. It has a large cup, also like the M3 and the M6. Then we also have the M6, which is comfortable, actually meant to be used by elderly patients and also pregnant women, that does not have a constriction when it's inflating and deflating. The memory is fine. Then the M7 has same cup size with the M6. It's also a product of choice for the elderly, but an additional feature is the IT, which is the Bluetooth device. So you can pair it with your phone and send your result down to your healthcare practitioners. Then we also have the new product online, which is our Omron Complete. Omron Complete has an ECG attached to it. So when you check your blood pressure, you also check your ECG. So it's a product that is a must-do product in your pharmacy space. Then we have the Evolve, it's a tubeless product. Then I move on to the pharma ranges of products. We have the Ephamoiblin Primrose, the Ephamoiblin Primrose. It helps to balance the hormone and glues the skin. We have the brain liquid and the brain capsule for children. We have our newbies in the pharma ranges. We have the amlodipine, we have Cavidilol, we have Losartan, we have PCM suppository. And I promise that when you come to our stand, we have some freebies for you. When you purchase our product, we have freebies to share with you. So I'm inviting everyone to our stand, and I know that you will not regret coming to our stand. Thank you.
Okay, my name is Mrs. Rito Ojukwu, the Regional Manager of SAM Pharmaceuticals. Today we are here to represent SAM with the ranges of products that we have in display here. I will start with a brief introduction of each and every one of the products listed here. This is our brand of amlodipine for the management of BP cases, and this is our brand of prednisolone. This is Prednisam by name. This is also our brand of metronidazole tablets, 200 milligram blister pack, 10 by 10. And this is our beautiful product, Ascovite, chewable and 100 milligram. This is by 1,000. This is our Bicosam. And these are special products I also want to introduce to the public. These are a brand of diclofenac and paracetamol, Inflanil by name, a product of excellence. This is one of the top-notch products SAM Pharmaceuticals have in store. And these are precious paracetamol 500 milligram blister pack by 96, the red sachets. And this is quality inclined. We are here with quality, we are not here with quantity. If you've come in contact with some products, you know that what we preach is purely quality and not quantity. Then this is our brand of cotrimazole 480 milligram blister pack, 10 by 10. And this is our beautiful brand again of cyproheptadine with multivitamin. This is specially made for the management of cases of children that find it difficult sleeping. This is good for them. This is also good for the management of any kind of any kind of multivitamin management. And this is our brand of Adozi, methyl dopa. Adozi by name, 10 by 10 blister pack from SAM Pharmaceuticals. And this is another beautiful product from SAM Pharmaceutical, Mazeron capsule, our ferrous iron capsule, encapsulated for pregnant, young, old can take this. And this is our flagship products, Acipep by name, which is our brand of antacid with anti-reflux action. And this special in the market with the content that it comes with. Presence of organic acid. And this is the blister pack, the chewable tablet. This is equally very, very special because this is the first of its kind in the market. The only antacid chewable that contains organic acid in the market. And SAM is proudly bringing it to the market with the quality that is inclined. And now to the beautiful products of the day. This is our Facita, our brand of anti-malaria artemether lumenfantrine. We have it in the 8480 and 2120. And a special thing about this product is that, one, the quality that it comes with, and the excellent results we've been getting from our users, our patients and our customers. This is a product of choice for anybody that is interested in first-hand treatment of malaria. Thank you. I remain my humble self, Rita from SAM Pharmaceuticals.
The Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria, PMG-MAN, in collaboration with GPE Expo Private Limited, presents the 7th Nigeria Pharma Manufacturers Expo 2024. Theme: 40 Years of Advocacy, fostering partnership and innovation to unlock the pharma manufacturing value chain in Nigeria, Central and West Africa. Keynote address speaker, Professor Padmasri Jalsampat, Chief Executive Officer, African Pharmaceutical Technology Foundation, Kigali, Rwanda, and Senior Advisor to the President, African Development Bank, AFDB, Abidjan, Cote d'Ivoire. Special guest of honor, Dr. Tunji Alausa, Honorable Minister of State for Health and Social Welfare, Federal Republic of Nigeria. Chief host, His Excellency, Mr. Babajide Sanwo-Olu, Governor, Lagos State. Host, Oluwatosin Jalayemi Esquire. Chairman, PMG-MAN, CEO Managing Director, Daily Need Industries Limited. Date 4th to 5th September 2024. Venue, the Balmoral Convention Center, Sheraton Hotel, Ikeja, GRA, Lagos, Nigeria. Time 10 a.m. daily. This hybrid event will be streamed live on PharmaStream TV YouTube channel, inclusive of all PMG-MAN platforms. Subscribe to these channels for live notifications. Announcer, Pharmacist Patrick Aja, Chairman, MPME 2024, MD, CEO, May and Baker Nigeria PLC. Signed, Pharmacist Frank Mwaneme, Executive Secretary, PMG-MAN. The Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria, PMG-MAN, in collaboration with GPE Expo Private Limited, presents the 7th Nigeria Pharma Manufacturers Expo 2024. Theme:
the very civil manner in which we are consuming the consumables. I will not eat until the last person eats. But while you are doing that, I want to invite the Secretary of PSN Lagos, Francis Tosin Adeyemi, MAW, to give us the vote of thanks.
People are busy eating, you know. Thank you very much. I appreciate sincerely. I'll make it very brief because people who speak when others are eating tend to promote annoyance. So I'll make it very brief. On behalf of the CPC and, all of the executive members of PSN Lagos, the chairman, vice chair, all of our executives, I want to appreciate everyone for being here today. Very importantly, I want to appreciate the governor, the executive governor of Lagos State, Mr. Babajide Sanwo-Olu, for honoring us with his presence today through the executive secretary of LASHMA. Also want to appreciate the SSA to the governor for also finding it worthy to be in attendance today. Also want to appreciate our chairman of the occasion and his lovely wife, Pharmacist Victor and Adetutu Afolabi. They've been very wonderful. They're always available every time we call on them to be in any of our meetings. They're wonderful people, always supporting. Also, I want to appreciate our keynote speaker today, my own Egbon, pharmacist Dr. Tometi. Is an excellent speaker. I'm sure everyone here enjoyed his delivery. Top notch, I must say. Thank you very much. I also want to thank everyone who is here today. As pharmacists, we make our input into the daily lives of Lagosians all across the nooks and crannies of Lagos. Helping them to live well, be well, and, continue to be useful economic citizens of Nigeria. I want to say thank you to every pharmacist, and I've also met pharmacists' children in this hall. I've also met pharmacist spouses in this hall. So I want to say thank you to everyone for being here today. And I trust that as we leave this meeting, we will remain important ambassadors of pharmacy in everywhere we practice. On behalf of the chairman again, I want to say thank you and congratulations to every one of us. God bless every pharmacist. God bless the PSN Lagos, and God bless Nigeria. Thank you very much.
Thank you very much, the Secretary, PSN Lagos State. We will declare the meeting, the event closed, but that automatically opens the floor for music, networking, and fun. Why you do that? In the name of the Father, and of the Son, and of the Holy Spirit. We thank you, Father, for today. Thank you for this week. Thank you for tomorrow. Thank you for Saturday. Thank you for PSN. Thank you for pharmacy. We ask, O Lord, as we finish this event, we depart in peace to meet again in peace. We depart to meet and come back in our enlarged coast to the glory of God and to the benefit of mankind. See you next year. Thank you. Hey, can't you see me on the mountain here? I've been on the mountain here since morning. Let me come down. I'm going to give the microphones to the owner.